Greetings, ladies and gentlemen, and welcome to the United States Transhumanist Party Virtual Enlightenment Salon of November 15th, 2020. My name is Gennady Stolyarov II, and I'm the chairman of the United States Transhumanist Party. And with us today, we have an eminent panel from the US Transhumanist Party, including our Director of Applied Innovation, David Shoemaker, our Director of Visual Art, Art Ramon Garcia, our Secretary, Pavel Ilin, our Director of Scholarship, Dan Elton, our 2020 US Vice Presidential candidate, Liz Parrish, and our special guest, Dr. Edward Hudgins, who has been a longtime member and friend of the US Transhumanist Party. He has held many roles throughout his career. He has worked for the Cato Institute, the Heritage Foundation, the Atlas Society, and most recently, he has founded the Human Achievement Alliance. And the Human Achievement Alliance is going to be the first subject of our conversation today. So Edward, welcome, and please tell us about the Human Achievement Alliance, what it seeks to accomplish, and the relationship that its mission has to transhumanism.
Well, thank you very much for letting me be on the show, and especially with these folks who are great folks. I'm really honored to be in this group. But let me tell you, this is something. My background is in public policy, even though I have a degree in political philosophy. So if you guys want to talk about Aristotle or anything like that, I'm happy to do it. You don't have to do it in Greek, by the way. I'm happy to do it. But I've worked in public policy all my life, but also on socioeconomic, cultural issues. And something that I've seen for quite a few years, and finally I was able to do something about it with my own organization that I've just founded, is the Human Achievement Alliance, is this. Premise number one: we are at this time in human history, even with the pandemic, at an incredible time where exponential technology could be ushering in a future of incredible prosperity, of long, healthy, even transhuman lives. Living to 200 could be the new norm. This is no longer science fiction, and I don't have to convince this crowd, I think, about that. So at this time that we should be as optimistic as we ever were, even with the pandemic, we face a number of problems. First of all, our institutions are not aligned with the needs for the future. For example, the education system right now, there's a huge disconnect between the education system and even the needs right now for workers. But right before the pandemic, there were 1.6 million more job openings than there were unemployed people. Why didn't we have full employment? Well, because the schooling system just doesn't match people up well. And in the future, we're going to need people to work with Liz Parrish, to work with Aubrey de Grey, to work with all of these types of folks to make the incredible breakthroughs we need for longer, healthier lives. And we have a system that's really not meeting those needs. There's a lot of other institutional problems we have as well. But there's also what I would call a cultural problem. And that's this. First of all, there's a lot of skepticism about exponential technology. There was a Pew survey, I think it was 2016, and basically they asked people about, what would you be comfortable or uncomfortable with a brain implant that could help you remember better and so forth, with some kind of artificial blood, I think, and the third one I think was the lung implants to help you breathe better, so you could run 10 miles without huffing and puffing. 60%, 65% of people said they're very uncomfortable with this, and for interesting reasons. Some of the reasons were sort of conservative, well, it's tampering in God's domain. But some of it was, well, we're just uncomfortable because we might produce a race of supermen who are going to rule us. And we see that same sort of concern about, for example, artificial intelligence and robotics, that somehow, we're going to have these, robot masters. And again, we've got data to show that this is the case, that we have this kind of skepticism. And interestingly enough, it's not just, you might think, well, maybe that's politically coming from the right. It's not just the right. Interestingly enough, some of it is coming from what you might call the left, and part of it has to do with inequality. For example, um, when Mark Zuckerberg, about 4 or 5 years ago, said he was going to devote $3 billion to curing all diseases. Okay, a little bit of a stretch there, but one of the columnists in London, I think it was in the Telegraph, wrote, "This is a horrible idea because the planet is overpopulated and we need more people to die." I mean, like, I can show you the quote. It's in a lot of my papers. We need people to die. This is a bad idea. There are too many people on the planet, which is insane. Um, there was another commentator who basically said, well, this is simply going to mean we're going to have a few very rich people living 100 years or 1,000 years or whatever, and then everyone else is going to be dying. Again, they don't understand Moore's law, certainly not applied to the cost of sequencing a human genome, right? And so you see this kind of misinformation that's out there. Is not, and again, it's on all sides, and it's among educated people. These aren't people who never have heard of this stuff. And also, you have a culture today that seems to be dominated by pessimism, by nihilism, by anger, by malevolence, and that mindset limits your expectations. It limits your aspirations. So, what I'm trying to do with the Human Achievement Alliance is sort of leverage the needs to reform our institutions. And by the way, we were talking before we came on the air, for those of you watching right now, about the Food and Drug Administration, the fact that it takes 10 to 12 years at a cost of $3 billion to bring a new product from lab to market, because our 1962 antiquated regulations simply can't keep up with exponential medicine today and breakthroughs. One of the examples I give is, it was last April of 2019, Scott Gottlieb, head of the FDA, just before he stepped down, issued a call for how can the FDA regulate artificial intelligence applied to medical research as a medical device. And you say, a medical device? Well, what's that about? Well, the FDA has regulatory authority over medications and medical devices. It's not a medication, so it must be the medical device. Therefore, they're going to regulate it as a medical device. Of course, which to any rational person sounds absolutely insane. By the way, this insanity, because I've done a lot of scholarly work, and you can see it on the Human Achievement Alliance website. Back in, I think it was the late 80s or early 90s, the FDA tried to classify essentially a specimen cup. This is not one, but imagine just a little plastic cup as a Class C medical device in the same category as heart valves. Now, the court knocked that one down, okay? But that gives you some idea of how disconnected a lot of our institutions are with reality. So what I'm trying to do is leverage the need for an education reform, reform in the Food and Drug Administration and related institutions, in labor laws, and so forth, with the need to raise consciousness about what can be done with exponential technology. We in the Transhumanist Party know all of this. We're the ones who read Peter Diamandis's great books. There's one of them right there. Future is faster than you think. I reviewed his first book. We are very optimistic, but what I want to do is take our optimism and break it out of this wonderful program. Okay. My background is partly in advocating ideas. And so, for example, space policy, I'm big on space colonization and stuff like that. And so there's my book on this. Anyway, and so, for example, in the late 90s and early 2000s, many space advocates here in Washington, D.C., were putting forward the idea that space is a place, not just a government program. And for example, a coalition had every month or so, maybe they'd get a Congressman Dana Rohrabacher or somebody to sign out a room on Capitol Hill. They'd bring in sandwiches and drinks to the hearing room. It was mainly staff coming in, and they'd have a luncheon. Maybe a member would speak, maybe someone from NASA would speak, but usually it was other advocates, basically sort of preparing the ground for the fact that there were lots of entrepreneurs out there who were really interested in space. But one of the problems is that you have to go from agency to agency to get permission to do anything. And the government prefers to put stuff on their own overpriced rockets rather than a less costly a private rocket, et cetera, et cetera. So what we were doing was preparing the ground for when an Elon Musk and a Jeff Bezos and these guys came along. I was getting lots of invitations back then to Neil Cavuto is a guy who has a show on Fox News. I think it's at 4 or 5 o'clock. Pretty popular show. Every time there'd be a shuttle flight or something like that, he'd usually invite me on. It's like, well, Ed, is it true that it really takes $500 million to just get one of these things up? Isn't it possible to do it at less cost? And I would say, well, yes, let's take a look at the free market that's brought down the costs of these things and all this other stuff. Wouldn't it be great if we could get that entrepreneurship for space? What I want to do is exactly that sort of thing for what we're talking about here. Imagine if the ideas that we have from David Sinclair or from Aubrey de Grey were being circulated on not only on Capitol Hill, but among influencers here in DC, among influencers in the news media. That's part of what I want to do to help change the culture. And I see that there's a thirst for this sort of thing. Now, one thing I will mention now, and I will mention it next year because that's when it'll be important. What I've done, and you can see this on the website, I've set up the idea of a Human Achievement Day. And at first it was going to be July 20th because that's the anniversary of the first moon landing, but schools are not in session. Unfortunately, most schools are not really in session right now. But the idea is I thought October 21st is the anniversary of Edison inventing the light bulb. So wouldn't it be great? I mean, we have a Labor Day, we have a Veterans Day, we have a Memorial Day, we have an Earth Day, we have to go down the list of all these days. Wouldn't it be great to have a day where kids in classrooms talk about where did all this stuff come from? Where did the fact that we're having this meeting right now come from? Who's this? Many of them actually probably do know who this Steve Jobs guy is, but what was his thinking? Where did he come up with all of this stuff, right? Or any of these other achievers. And to have a whole day, maybe you could do it in a week. There's all sorts of different ways to do it. You could do it in your local community. You can have a town fair where, we have lots of towns, things here in Rockville. Dan goes to that probably. Hi, Dan. But where we basically make this kind of a cultural thing to celebrate achievement, to think about these kind of things. Why is it that in 2018, in April, the enzyme telomerase was sequenced? Now, all of you know on this call know how profoundly important that is. That's the enzyme that keeps the telomeres on your chromosomes growing or from shrinking. And as long as they're not shrinking, that means you're probably not going to be aging much, right? So sequencing that enzyme means that scientists now can go to work on trying to figure out how to operationalize it so that we don't age. Why wasn't that on the news? Why doesn't everybody know about that the same way everybody knows that on July 20th, 1969, 2 human beings walked on the moon? Why aren't there statues? I mean, we've got people tearing down statues. Why aren't we putting up statues to people like that? So a Human Achievement Day would focus attention. So that's October. That's coming up. But the thing is, it's not just one day or 1 week. It's a whole movement that I want to create with the Human Achievement Alliance. I come from a libertarian background, very freedom-oriented, obviously. So I know those groups and those communities, but I want to work with others. I want to work with the actual scientists. I want to work with the folks who find the government getting in the way. I want to work, and I've got 4 areas that you'll see on my website that I'm going to be focusing on in terms of leveraging the public policy ideas with the culture. the education revolution, first and foremost. Peter Diamandis likes to say the system is baroque and broke, and he's absolutely correct. We have a system that was set up in the 19th century, an assembly line system, and it did work at the time to take masses of people and make them literate. That was very necessary, but that's not how real people, and I've got 9-year-old twins running around out here. You may hear them yapping a little bit later. I know they both learn differently, because I have to sit down and say, this one really knows how to do it this way. This other one can't figure out what the heck's going on. So we need a revolution in education. It gets away from the sage on the stage, assembly line, mass production approach. That's first thing. And by the way, and I don't want to get too political here, but one of the sources of the nihilism, of the postmodernism, and that sort of stuff is our universities. They used to be places for exchanges of free ideas like we're having here. We'll have discussions. You probably will disagree. That's fine. But in universities, more and more, you can't do that. More and more, we have the cancel culture. We have just shut up because we don't like what you say, Ed, and we're going to dox you, and we're going to have people demonstrating in front of your house. That's not what we need. So we need an education revolution. That's number one. We need a revolution in healthcare, future medicine, that sort of thing, because that's the way you're going to get to living to 200 or even longer. By the way, I want to terraform Mars, so it's going to take a little bit more time than I have. So I need to get that life. So we need to do that reform. Reform number 3 is what I call future commerce. Labor laws are not good. The way we do training and apprenticeship is not good. There's a whole lot of things there. And the fourth one, and I don't have this section up on the website, but it's going to go up very, very soon, is working with, I'm calling it right now, inner city, underserved populations, because to me, that's one of the great American tragedies. I live not too far from Baltimore, Maryland. And I remember as a little kid when they had the riots in Baltimore and Washington in 1968. And I remember 5.5 years ago when they had the riots in Baltimore. And I've watched what was a great city just falling to pieces. They had 13 high schools in Baltimore City. A couple of years ago, they had 0 students proficient in math. Not only 50%, not only 40%, 0. They're dangerous places. They're probably some places more dangerous than prisons. We're here, I'm here in the state of Maryland. Right over here, if I look out my window, that we have the I-270 Tech Corridor. Only about 4 or 5 miles from where I am sitting right now is where Craig Venter sequenced the human genome. We have this incredible technology state, and yet we have these disconnected folks up in Baltimore City, who are in terrible shape. Where's the connection there? We've got 50 years of policies that haven't worked. And I think when I say serving those populations, it's not the right word. It's liberating those populations. It's basically giving them the choices so that they can become part of not only the American dream, which I'm big on, but our futurist dream. So that's why I'm so optimistic, even in this age of pandemics. So I hope people listening will take a look at the website, humanachievementalliance.org, explore it. My email is there, and what I'm looking for is to find allies, to find people who say, hey, I've got a great idea how to do this part or that part. I got folks in my town who'd really be interested in this, because I've worked with alliances in the past. And so I see that as part of my, I might say niche, is working with the Transhumanist Party, which I am a member of, but with these other groups. And I really see the possibility, especially in this age of pessimism and polarization, of being, I don't like to call it the third way, I think it's the only way, okay, of moving ahead with optimism, of letting entrepreneurs like Liz here be an entrepreneur and do what she's doing, and these other entrepreneurs to do what they're doing, so they can do for all of these other areas what entrepreneurs have done for communications and information, which is why we're having this wonderful discussion right now.
Yes, indeed. Thank you, Edward, for this overview. And I would say the aims of the Human Achievement Alliance definitely dovetail with those of the U.S. Transhumanist Party and the kind of atmosphere that the virtual Enlightenment salons seek to cultivate. As you pointed out, this due to technology, due to the ability of people to congregate in these virtual venues, has become a more effective and constructive way of holding discussions than the university system facilitates. And it's interesting to consider, how do we scale that up? Because I have observed that one of the major obstacles to public acceptance of transhumanism, as well as more generally the pursuit of emerging technologies and a rational techno-optimistic culture, is a simple awareness gap. That is, we exist, our community exists, we engage in these robust discussions, but we should be getting hundreds of thousands of views on these streams, given the importance of the ideas that we are articulating. So what are some of your ideas for how to bridge this awareness gap?
Well, obviously, I'm trying to do it right. That's what partly what Human Achievement Day is about, and that's going to be something, because obviously this year has been, just a bizarre year. You can't go to local schools because everything is done online. But what I'm seeing is, from now until next October, hopefully things will be opening up, of engaging with, for example, you can probably do it first with homeschoolers and maybe with charter schools. We have some charter schools in Maryland that have a little bit more flexibility, for example, than the public schools. So, I've been developing classroom materials. Actually, I developed some years ago that can be done, and I want to engage with some of the groups that run homeschools. They have homeschools associations, essentially. So what I'm going to be trying to do is, for example, reaching out to them, trying to get them, first of all, interested, and say, hey, the future of the kids you're teaching is right here. So you really need to be conscious of the exponential technology, where it came from, where it's going. And I'll provide some materials for you, or work with other groups that can provide materials, educational materials. So homeschoolers, businesses as well. I want to develop packages that you can send to local businesses. I'm going to be reaching out to some entrepreneurs who I know, and say, hey, how can I get to some of your other business friends to do this? Maybe Dean Kamen, he's the inventor of the Segway and many, many other incredible things. There's an artificial arm he invented that I'm really big on. I've featured that in some of my talks. Maybe Dean Kamen, and he runs, by the way, he's been running for a decade or two, kind of a STEM program for kids. It's wonderful. So maybe if I could get Dean Kamen interested, or there's a guy in Baltimore who has the Under Armour clothing line, which is a sports line. He's a Marylander, by the way, Dan. He's from our area, graduated from University of Maryland, grew up in Kensington, right over here. And so if I could get that businessman, who's fairly prominent here in Maryland, to do some sort of thing. So I'm looking to reach out to businesses, civic organizations. And part of what I'm doing is I want to make this, in a sense, a natural development, where, for example, anyone on this call, or the Transhumanist Party, or I do a lot of work, obviously, on social media. I want them to contact me and say, hey, I've got an idea about this, and work with them. And they say, I want to try to do something with small businesses in San Diego. We want to come up with a little contest on what's your favorite business, in San Diego, and why they've done something really cool, and how did they do it, right? Or, I've got a whole bunch of stuff you can do in classrooms. So I'm looking at ways to do this. I'm also looking, as I say, here in Washington, D.C., now that the election seems to be clear. I mean, I think that even with recounts, I think that it's going to end up being Biden. We could talk about the election stuff soon, but I assume the Republicans are going to control the Senate, so there's going to be a check there. The Republicans gained in the House, and I actually have worked with a number of them on FDA reform. We tried to reach out to Democrats, but it was so polarized that they wouldn't talk to us. But I think now there's a lot more openness of, okay, we've got a divided government, so we got to work together. So what I want to do is what I just spoke about earlier, is I want to see if I can get together, maybe with Singularity University, maybe with Abundance, maybe with Transhumanist Party, I don't know, and do some of these things on Capitol Hill, because I know some members of Congress who may sign out a meeting room for us to do this. So we start doing this in DC. Maybe we do it at the National Press Club. That's another way that we used to get publicity for not just space stuff, but for things I did with the Atlas Society and some of the other groups. So then you get a lot of reporters coming. So now you're on their radar screen, right? And then when something comes up concerning exponential technology, they say, I remember these guys who did this thing. Let me reach out to them. So I'm looking at ways of doing it here because I'm in a particular base, a media base and a public policy base, and looking at influencers. So, this and what I want to do is I want to make it an agenda item, because if you look at agenda items, it's usually the economy, it's healthcare, it's kind of a lot of traditional things. Certainly, we fit in with healthcare. I mean, quite obviously, but I want to look at ways that exponential technology and what can happen in the future is a defining what's the word I'm looking for here? It's bracketing our discussions. So it's something that people always think about. Well, there's a question here about a new labor law. Well, how would that affect our future with exponential technology? And I would like to see that question be on people's minds when they start looking at public policies. And again, this is also a way, just having this conversation is a way of pushing back against the pessimism and the nihilism, and replacing it with optimism, purpose, joy, and achievement. Just having this discussion, is going to help do that.
Excellent, thank you. And we do have some comments in the chat, which I think would be good to address. One of our members, Mike Lazine, is quite enthusiastic about the space colonization aspects of your presentation, and he writes that he has been a fan of space colonization for a long time. He seriously supports NASA's exoplanet missions and would like to see humanity construct a permanent base on the moon and then terraform Mars. But he also notes that in his view, inequality is a concern, and he is worried that minority transhumanists will be shut out of a lot of transhumanist technology. So how would you respond to that, given that you've addressed some of the key themes that are involved with this already? And if you would care to elaborate, I think this would go a long way toward alleviating his concern.
Sure, exactly. Yeah. Well, in space, of course, I completely agree about these things, and as I say, my optimism about that, because I was I'm revealing my age, I guess here. I was a high school teenager at working as an intern at NASA Goddard, which is here in Maryland, a major space base, in July and the summer of 1969 during Apollo 11. So talk about a kid in a candy store. I'm watching the first moon landing from a space base. Wow. Anyway, and then I got Buzz Aldrin to do a chapter in my book. So how cool is that? Okay, thank you, Buzz. But one of the things that space activists like me have been doing for many, many years, even decades, is trying to make the point that space is a place, not a public policy. And fortunately, we have had a lot of reforms that have allowed that, to Michael's question. The COTS program, for example, telling NASA you've got to buy services and not just hardware. And of course, now we have a situation where SpaceX is not only delivering cargo to the station, I think Orbital is doing the same, but they're actually delivering humans to the station. Bezos has been a little bit slower, not in the bad sense of the word, but he's kind of taking more of a step-by-step approach. And I note, by the way, that this is, in both cases, private money. These are private entrepreneurs. We had at one of the events that we put on at the Atlas Society, one of Elon Musk's chief rocket designers. And he was showing us stuff that was going to be coming out, like the grasshopper thing, which you probably all know about before it was ever out. He was showing us that stuff. But what was interesting is some of the stories about how Musk was able to do what he was doing. So, for example, pretend that, let's see, where get a prop here. Here's a nice prop I got right here. Okay, at the bottom of the, on any kind of a rocket, right? You have the bells or the cones at the bottom, right, where all the fire comes out and everything. Well, at one time, they had a rocket that they were working on, and they're going to be trying to launch soon. And they went to Elon and they said, we found a little 6-inch crack, like right there at the kind of bottom of the thing. And we want to bring that to your attention and, talk about what we can do. Now, if it was NASA, NASA is a huge government bureaucracy, okay? And I know people at NASA, there are a lot of very nice people there, very intelligent people. So there's nothing against any of the individuals. It's just that the way it's set up, it's a government bureaucracy. So what happens? Well, we've got to protect our butts. We've got to put it through a comment period. We've got to let everybody and his brother who have any association with this thing make their comments and do their reports, and then cross-read all the reports and congest all the reports. And then there are congressional committees who are going to be overseeing us and saying, why didn't you do something about 6-inch crack? It takes months and months to get over a 6-inch crack. So what Elon did is he asked his engineers, says, think it would make any real difference if we just cut off a 6-inch ring at the bottom, just pull that 6-inch ring off. And the engineers took out their calculators and did a little bit. Probably not. He said, okay, go ahead and do it. Or, on the side of a rocket, you have these very, very small little, gimbals that kind of go like that, right? And when they were doing some initial rocket design, Elon apparently asked, well, can you go and see who did this for NASA and how much they cost and all? And it was some incredible amount, how many hundreds of thousands of dollars for each. Found literally you could get the same motor at a hobby shop that did exactly the same thing. So that's what they did. And the point is, because he's a private guy and his own money, he could say, I can do whatever the hell I want. I can take whatever risks I want. So I'm very enthusiastic about the fact that NASA now, is like, if you can't beat them, join them. So they're starting to contract out for these services. And I think that that's going to really help us in the future, because it's only entrepreneurs who can really bring down the costs of goods and services and bring up the quality, whether you're talking about this, your smartphone or whatever it is. To the second point that Michael brings up about inequality, I actually have a piece on the Human Achievement Alliance website about identity politics versus human achievement. And I think it's absolutely crucial morally, as well as practically, to put forward the idea that we believe, or I certainly believe morally, in judging a person, in Martin Luther King's words, by the content of their character, not by the color of their skin, or for some accident of birth, whether they're man or woman or gay or straight or Hispanic or it's whatever it is, okay? I think that's crucial, and to hold the standards. Then what you have to do is, if you say, if there's inequality because of some particular, say, government policy, then you deal with it directly. I think there is inequality because the schools in Baltimore City are run absolutely pathetically, and the poor parents in those schools have no choice. They can't, if they're poor, they can't move out to the suburbs. You can't fire the principals. You can't fire the bad teachers. They're stuck. So I would say, yeah, there's a problem there, but it's not that there's not enough money thrown at the schools. In fact, Baltimore City, and I think I put the link on a piece I did, I think it's on the website about this. Or actually, no, I did a piece last week in the Baltimore Sun addressing Maryland Governor Larry Hogan as a Republican, but in a very Democrat liberal state. And if you go to the online version of the Baltimore Sun, I have a link to. In fact, Baltimore City spends as much, per student as pretty much any other place. Washington, D.C., at least for decades, spent more per student, per pupil, than any of the 50 states. David Bozet Cato ran the numbers for this, and I haven't run them lately, but they spend incredible amounts of money per pupil. It's just that it never gets to the classroom, or it's spent so inefficiently. So it's not a matter of we need more money to deal with these inequality issues. It means that we need to deal with the systems. And I would add to that, we need to deal with what I would call the culture. We need to encourage a culture of achievement. There's a lawmaker in Baltimore City, I have to look up his name, I saw this recently, who, for example, is very interested in apprenticeships. Now, when you think of apprenticeships, you probably think of carpentry and electricians and plumbers. And by the way, we need people like that too. I've got some leaky stuff upstairs here, so I'm going to probably be looking for one. But the so-called not blue collar, but the so-called new collar apprenticeships are things like in finance, obviously technology. There's teachers, et cetera. And I've got a whole section or links on my website about this. In Switzerland, 70% of kids go through an apprenticeship program. It's kind of a learn and earn tryout for a job. So maybe they work for a bank, maybe they work for a pharmaceutical company, maybe they work for, whatever it happens to be. And, they, first of all, they get paid. So think of the morality. Hey, I'm actually providing value for value. I'm getting the work experience. I'm learning how I've got to deal with other people, all that kind of good stuff. And so I know that there's some folks in Baltimore City now who are interested in that. So rather than talking at some broad level about inequality, I want to look at the particulars that are, for example, holding people back in Baltimore. And by the way, I know in Chicago, the single biggest budget item last year in the Chicago Board of or Education budget, almost 40%, was just to deal with to cover the pensions of retired teachers. Now, I'm all for people making a lot of money and putting money aside for retirement. I wish I had done more of that, frankly. But the point is that you didn't have a market, so it was very easy to buy the teachers off with these humongous pensions, far above any private sector pensions. And now, 40% of the budget goes into just teacher pensions. And if you start chipping away and see how much actually goes into the public schools of Chicago, it's not a whole lot. So I agree about the problems of inequality, but what I want to do is get beyond some of the rhetoric, whether it's Republican or Democrat, I don't care what side, and look at the particulars and then say, what can we do? Because I'm for opportunity. I'm for for that sort of thing. By the way, there's a group called Institute for Justice, headquartered here in DC. It's a really great group. Their specialty is, for example, going into places like Baltimore, St. Louis, Chicago, Cleveland, and let's say you've got a woman who wants to basically open a beauty salon or basically a place to do other women's hair and so forth out of her living room or her basement or something. And if you look at most cities, they have a system where it's almost impossible to do that. They have requirements. Well, you have to go to 2 years of beauty school. Wait a minute, it's just doing something that I do for my friends already. Well, you got to 2 years of beauty school and here are all the licenses and all. And what the Institute for Justice does is they go and they sue the cities and basically say, this is ridiculous. Let these people open their businesses. And they've been successful. So again, a lot of these things, you really have to know the details of what exactly is the nature of the problem. Many of you might have heard of what are they called? Brownfields. In a city, let's say you have a city where building has been torn down and there was a certain business there, and maybe there were some pollutants that they used. Maybe they used some paint thinners and stuff like that. Well, the requirements would often be you have to take that so-called brown field and clean it up to such an extent. They literally have something in the regulations that says a kid has to be able to eat a certain amount of dirt and spoonfuls of dirt each day and not get sick from the pollutants. Now, if you're building a playground there, it kind of makes sense. If you're building a garage there, it doesn't. So again, a lot of times you've got to look into the details and say, what is it that's holding back? Entrepreneurs who might want to go into St. Louis or Baltimore or Philadelphia or whatever the place is and do these things. And I'm all for liberating people because I believe that, I'm coming from a working class background. Okay. Right now I'm in Montgomery County, Maryland. I came from Prince George's County. My mother's family were all Italian immigrants. My dad's family were all working class. My grandfather was a butcher. My dad was a truck driver, delivered bread. I was one of these people who had to clean toilets and to be a janitor and do stuff like that to work my way through college. So I appreciate hard work and I appreciate the need, but I also appreciate the need for opportunity. To me, that's what's most important. So, Michael, this is something we should talk about, but and act about. But I want to sort of get beyond let's just throw money out of there. Let's just create quotas or things like that. Let's get to remove the things that are basically keeping people from doing, from doing their thing.
Great. Thank you very much, Edward. And I will pose one more question on education before we proceed to regulatory policy and the FDA. Alexandria Black, who is the US Transhumanist Party Director of Community Resilience, asks, what do you think of the education system in Finland, which she characterizes as not focused on single subjects, but a broader approach?
Actually, it's a very good question because and this is what I'd love to see an open discussion in this country about. There are different ways of approaching education in different countries. Some are very sort of focused on, we want to give you the a generic grounding in a lot of subjects, generic grounding in math, a good generic grounding in this and that and the others. There are others that are a little bit more open. Well, we'd rather have you sort of be the more of an expert in this or whatever. South Korea has a fairly successful system. Finland does, and I could name a few other countries, but they do it very differently. And what's interesting is this is one of the nice things about a free market. I want to see a free market in education, just as, we all understand how a free market works in technology, right? Different, companies try different things. Apple tried the Newton, everyone remembers that, and it was a kind of a joke, and it didn't really work. And that you try different ways of doing things, and you let consumer choice deal with that. By the way, I'm very keen on sort of the Montessori approach, which basically is you kind of let kids, gravitate to what they like best. You maybe give them a grounding and stuff, but you sort of let them, if they really hate math, you give them some math, but then you let them gravitate towards the other thing. Here in Prince George's County, we have a thing called Eureka Math. They've suddenly imposed because of Common Core on all the kids. And one of my daughters struggles with it. Normally, most of us know that if you multiply, let's see, there we go. Normally, if you multiply, what do I have? 137 times 36. Most of us would basically say, well, you take and you multiply 6 times 7, you put it down there, you carry the number, and that's how you get the number, right? That's how we all learn. Well, they do this thing where they say, okay, break it up into a strip tab and put the hundreds over here and put this thing over there and put this over here. And it's confusing as hell. And they even have to provide manuals for the parents to figure out what the hell all of this stuff means. And, I tell my one daughter who struggles with this, I say, honey, I'm telling the teachers and the principal, and they agree with me on this. I'm going to make sure you know how to do this. And if they say, let's do one of these fashionable tricks, I'm going to say, I don't give a damn about the fashionable trick. I want to make sure you get the answer. But here's the point. You mentioned, getting back to Finland, I want to see a competition in what works best, because I don't claim to be an expert. And the government experts aren't experts, because the government expert just imposed this stupid thing on Montgomery County, Maryland, which is one of the most prosperous counties in the world, in the country, I should say. And I know other parents who say their kids are struggling with this stuff and it's confusing them. So why not a market to determine what works best in education? I happen to think, by the way, that more of the open approach is probably better, because what we're going to need in the future for exponential technology is not just someone who really is great at this narrow technical thing, because that narrow technical thing might be taken over by an AI or robot sometime fairly soon anyway. So having kids with agile minds, I think in the end is going to be better. There's a lot of stuff I have learned. In the last just couple of years from reading a lot of books on, on biotechnology that I didn't know 5, 6, 7 years ago. And, so I can learn the stuff. If I know generally how to approach a question or an issue or a subject, I can basically read the book and get all the information and download it. Hopefully I'll be able to download it sometime by putting one of Elon's little things in my head, right? But that's exactly the kind of discussion I want to see in this country is, does the Finnish approach, is it better than the South Korean approach? Probably, I think all of them probably are better than a lot of the approaches in this country.
Yes, thank you, Edward. And now, as I've said, we shall move on to regulatory policy and the immense obstacles that biotechnology research and longevity research in particular face in this country because of the Food and Drug Administration and its restrictive and protracted timeframes. So as an example, there was an experiment done by David Ishii, who is a transhumanist biohacker, on Dalmatians, where he essentially bred genetically modified Dalmatians that did not have a certain hereditary disease. And the FDA found out about this and essentially instructed him to cease implementing these kinds of approaches unless he submitted to FDA regulation of his Dalmatians as drugs, because the FDA has oversight over food and drugs, and dogs are clearly not food in the United States. So they essentially shoehorned the dogs into their drug regulatory framework, and they had all of these protocols essentially intended to prevent these Dalmatians, who are healthier than ordinary Dalmatians, from getting into the general population, including a very cruel instruction to David Ishii to essentially, quote, dispose of these animals after the experiments. When I read the demands that the FDA was making of David Ishii, I was just appalled that this is, one, what regulators spend their time on, two, how they would approach a treatment that's clearly intended to extend and save these creatures' lives in some cases, and instead they're essentially ordering him to kill these animals. And the last I recall, my information is about 2 years old at this point, he essentially decided that he would rather not go through with the experiments than have to submit to these kinds of odious terms. And of course, another situation is one we're all going to see the outcomes of with Operation Warp Speed and the accelerated review of COVID-19 vaccines. And yet, even though Pfizer and Moderna both have announced vaccines that are quite safe and over 90% effective, they're still not widely available because there still has to be another review process before they're able to be distributed to the public. And in the meantime, we now already have thousands of deaths per day from COVID-19. So it just seems like there is this unconscionable approach where these delays are leading to deaths from the non-availability of these medicines or treatments. And yet the system seems to be largely uncaring about that. So with that preface, what are some of your ideas for reforming the system? I know you've stated in the past you don't quite go as far as the US Transhumanist Party and that you wouldn't support abolishing the FDA, but you do want to implement some significant reforms.
That's kind of a pragmatic judgment in this sense. If I were, if we were setting up a Platonic Republic and you would saying, how do you want to do this? I would probably say, let's do it like Underwriters Laboratory and do it all privately, okay? So actually, in terms of the goal, sure. But in terms of how do you get to the goal, that's to me really the question. And so, and realistically, and this is part of how I'm coming at this. I'm not, because I'm forming a nonprofit or have formed a nonprofit. Technically, I cannot advocate for any particular piece of legislation. But what I can do is say, here's where a system is not working. Here are some ways that would certainly make it better, and here are some ways that would make the thing absolutely worse. And there's no one who's going to abolish the FDA anytime soon. So what I say is, let's work on some practical steps to move in the direction that we want. And what I would say to your point is this. The FDA was in its current iteration was put together in 1962. The concern, by the way, was the thalidomide scandal in Britain, where women had taken this product for something else, and they had deformed children. Now, it didn't occur here, fortunately, but the thing was, well, we want to take the FDA and we want to give them authority not only to certify the safety of products and the accurate labeling of products, but its efficacy. Now, what is efficacy? That's the big question. And in some cases, and normally you think of efficacy as, well, okay, let's say I've got diabetes. Will this particular, pill, cure, well, you can't cure diabetes as such, but will it be 50% effective? But would it be 80% effective for women, but only 20% effective for men? And you got all these kind of things. And everyone wants to have that sort of information. And the way you do it is you have double-blind tests where you have a placebo group. They don't know they're getting the placebo, and then you have the group that's getting the actual medication. And you go through, phase 1 is basically safety trials. Make sure people aren't going to die from the thing, right? Phase 2 is basically these tests to see how effective they are. A lot of things aren't very effective and drop out at that point. And then if it looks like it's really promising, phase 3 is to refine dosages, things like that. Well, here's the problem. Those tests have been becoming more and more onerous over the years because you have a bureaucracy and all of their jobs are dependent on this. And again, I know FDA people, they're not evil people or anything, but it's the way the system is set up. And what happens is you get an invisible graveyard of people who die because something is not available. They didn't know it was available. There was a case, and I've given, I know Dan saw this in a lecture I gave to the futurists here in the DC area. In 2000, there was a little girl, actually, I guess she was 18 at the time, who had some rare form of a neck cancer. And, all the normal treatments wouldn't work. And so 2001, I think it was, she went on local radio, local TV shows here in Washington area. She tried to contact some congressmen and so forth to see if she could get into an experimental program for something that might deal with her cancer. And for all sorts of reasons, no, it's not available, it's not available, it's not available. She died in June of 2001. A few months later, they approved the product that would have saved her life. There's a headline in the Wall Street Journal. I have this in one of my papers, which you can find on my website. And it was 100,000 killed from the Wall Street Journal. I think this was the late 80s, sometime in the 80s. And it was about beta blockers, which can be used for heart issues. And while they were available in Britain, they were kept off the US market for years because there was concern about, well, maybe there's a small cancer risk. Yeah, but if you're having a heart attack, it's probably the last thing on your mind, right? And I'm going to have to pause for just a minute and let you guys talk amongst yourselves, okay?
Yes. All right. Thank you, Edward. And we're on the subject of FDA regulatory policy and the problems with it. And of course, Liz has had a lot of experience with the suboptimalities of the system. So Liz, I would be interested in your thoughts regarding Edward's analysis, as well as what you think some of the improvements could be, even if we aren't able to abolish the FDA. What could make the process more amenable to innovation?
Oh, sure. So, the idea of the FDA and, helping drug companies create safe drugs is wonderful. The truth is that, none of the drugs that the FDA has passed have necessarily been safe. So, of the top 10 drugs, many people, they unwittingly take drugs that will eventually get them sick in other ways. For instance, statins drives dementia, and it also drives type 2 diabetes in staggering numbers. So the number to treat and the number to harm, are vastly out of whack, and people don't realize that when they take the drug. But these, one out of some 300 and some people might be saved from having a stroke by taking a statin. but 1 in 4 will get type 2 diabetes from taking the drugs, and about 1 in 10 will get dementia from it when you don't have higher levels of cholesterol. Cholesterol is important actually for functions in your body, and some of the science behind that is getting debunked as to how dangerous some of those are, but that's a whole different subject. But anyway, a lot of people just don't know about the drugs that they take now and how safe they actually might be for them, and how likely they are to actually help them. So, there's that whole side of it, that the FDA, even though, there's all the small print, is not very good at helping drug companies inform their clients, because when you're prescribed a pill, you're prescribed it with authority. And so you take it assuming that it is the best choice for you, and you don't read all the fine print. So we got to get out of the mindset that, FDA approved drugs are necessarily safe for you. I'm not telling anyone to stop taking their prescriptions, because your doctor has looked at the risk and also looked at what he can legally prescribe. Now, if he could legally prescribe things that have not yet been through the FDA but have shown much more benefit in all animal models and humans, early human studies, than those drugs had, do you think that he or she would prescribe them? I think they would in a heartbeat. And so, how do we take drugs that are in the pipeline, drugs that are way more powerful than this old, antiquated system of bad molecules that we take today, that all we're looking for is a side effect that might have a benefit? So remember, what you take when you take a drug is you're looking for a side effect. And unfortunately, you get a whole bunch of bad ones, and then you get hopefully one good side effect that treats your condition. And your drug has been cherry picked for that. It's called an endpoint. And the rest of them have been, sort of thrown out and added to a tiny print list of all of the negative effects. But when you're looking at gene and cell therapy, you're looking at just upregulating a protein, the very protein that your body needed. And this technology is just, it's been around for decades. It's just lying in the waste. I know doctors who now, we work with a company that does offshore work, but we have also historically worked with doctors who do work in cancer and all sorts of other areas, because they are good doctors. They are US doctors, but they can't use the drugs in the US because it's decades and decades behind on innovation. And if you are a company that's trying to take a drug through the US FDA, you will find an extraordinarily high cost that's associated with a safe trial. Well, you money doesn't equal safe, okay? And that really has to be debunked. And we're also going to have to take some risks. And some people, like a lot of people, over 100,000 people today, are dying. And so, they're taking the biggest risk, they're having the biggest negative outcome for our risk based society. So, so you're trying to take a drug through the regulations, you're looking at, Edward just said $3 billion. There's no way you can do it. So what you do is you just play this game. You try to get through safety, and then you try to get this next round of investors in for efficacy. For cherry picking your endpoint. And if you have a gene therapy, it's much easier because you're looking at an exact regulation of a protein, which you should be able to get. And then in phase 3, you actually have to be bought out by a large company. There's no small biotech that's making it through phase 3. They might keep their name. They don't own themselves anymore. And when you don't own your company, you can't drive more good innovation. So super broken system. And I'm really looking forward to getting Edward's help. Everyone today, if they are sick, have any sort of disease, and especially end stage disease, should get access to anything right here safely in the US, in a US hospital by US doctors. And actually, all of the data should be looked at. We should be looking at the negative and the positive data so that everybody can actually make an informed consent to technology. And the only way to do that is to get human data.
Absolutely. And this is a very good lead in. By the way, before I tell you one of the approaches, that was my father, who is 89 years old. He's been in the hospital for a month or so with blood clots, pneumonia, and all sorts of stuff in his lungs, which he actually had in March and got over it. And then they changed his medicines and it screwed everything up. And he's in a rehab facility. And about a week and a half ago, he was diagnosed with COVID. And fortunately, it's non-symptomatic. It looks like things are good enough. They can move him into the normal place for rehabilitation so he can get back to walking and so forth again. So, that's the good thing. But you mentioned about, and this is a very good point, you mentioned about companies and small innovative companies. We haven't had a new real treatment for Alzheimer's for 22 years on this market, something of that sort, which my mother has, by the way. And I would love to see a product like that. And one of the reasons we don't have it, the FDA advertises, well, we do have all of this, what I would call ad hoc thing for expediting products and so on and so forth. And they say, well, we do expedite products and so on and so forth. But what they don't look at is, well, what about all the products that never reached that point to begin with, that never reached phase 3 to begin with? So, you can't say, look, we expedited it. Yeah, but the Alzheimer's stuff never got there to begin with, right? One of the suggestions that, and I'll plug this book. We also have that on the website, the Free to Choose Medicine Approach. This is Bart Madden, who's a friend of mine and an entrepreneur and a great old guy. Anyway, and in the early 90s, we had the AIDS crisis, and killing thousands and thousands of people. Almost as many people died from AIDS as died in the Vietnam War. I think which year that was, but. And it was it wasn't like cancer. It was something that had been around for a while where researchers could do stuff, right? And so by the early 90s, AIDS activists were very frustrated with the Food and Drug Administration, as you could imagine. And in fact, they actually held siege to the building. There's one building in Rockville here, and then there's another one a little further away. And they actually had a siege to occupy the FDA building because they said, this is just ridiculous. We can't get this stuff through. And you say, well, we've got a product and it might work for 5 years from now, maybe we can do something. Well, I'm going to die in 2 years. And so 5 years is cold comfort. What they did was they created a parallel track for products just for HIV/AIDS. And this parallel track basically said, if a manufacturer chooses to put a product on a parallel track after it's been gone through the safety, phase 1, then they can choose to do that, and they can choose to give it out to more patients than otherwise would be accessed through the trials. And one product went on that parallel track, and about 12,000 sufferers had access to that product 3 years before it was finally approved. So there might have been as many as 12,000 AIDS sufferers who had their lives saved because they had access 3 years ahead of time to an experimental product. The free to choose medicine approach is basically that writ large. The idea is this, and this can be done legislatively, or it can be done in regulatory, but simply through regulatory changes. And that's how it was done with the AIDS thing, by the way. And I've got this documented in a piece that I have on the website there. Basically, once a product has gone through the safety tests and one efficacy test, then the manufacturer can choose to put it on the parallel track. And we call it a trade-off evaluation drug database. And what happens is, on that parallel track, a doctor or a patient with the consulting with physicians can choose to use that product, or if they want to just use what's already on the market, they can do that. Here's the thing. Their results will be put into a database, and of course, privacy protected, obviously, so that other physicians and patients can look at the database. And and as the data builds up from people who are using the experimental drugs, this is going to help. First of all, if the product really isn't terribly effective, it'll fail faster, right? Second, it is consumer choice, which I believe, because I do believe that, look, if it's my life, and it's like, well, I've got a 10% chance of living if I take this stuff, or there's a 50% chance if I take this other stuff, but it's still not, we're not sure if it's 50%. I'm going to go ahead and make my choice, right? But the other thing is, the data is very important. I heard someone at an FDA conference make this distinction. Where would you learn more about a tiger? Studying a tiger in a cage in the zoo, where you can experiment and give it a little bit of this food and this food and this food, or studying a tiger in the wild. It's studying the tiger in the wild that you're really going to learn about a tiger. It's studying these things instead of saying, well, we have to set up all of these. Well, okay, we're going to have a one control group that's 20 to 30-year-old females, and then we're going to have this control group and do all this kind of stuff. Why not just have the data flowing in, real world data? More and more, and I've got a whole paper on this also, real world data is the future. Just like Liz was saying, for a lot of products, this whole approach just really isn't applicable. And so the free to choose medicine approach would basically create this parallel track where you could get new products. Manufacturers could put them on the parallel track, and just like they did with the AIDS treatments. And you'd be getting this database. Now, by the way, I point out that in a sense, it's already being done. Liz talked about labeling and letting patients know what's in the product. The FDA already has a system that once a product is approved and it's out there on the market, they try to keep track of real world data so they can update the labels, because they're always learning more things about the product. So in a sense, they already are doing this. There's a consortium for medical devices. It's actually a public-private consortium. FDA is a member, but it's private groups that are putting it together to essentially do the same sort of thing for medical devices. So in a sense, they're already doing this way. We also have off-label use, by the way, of products. And Liz probably knows this story. Janati, you probably know this story, that for many years, doctors knew that aspirin was something that you could take if you're having a heart attack and certain kinds of heart issues in an emergency. But, and you have journal articles about it and so forth. But the manufacturer of aspirin, it would have been a crime for the manufacturer to tell a physician, look, if your patient's having a heart attack, use this. Now, they finally changed that regulation. But the point is, once a product is approved, physicians can prescribe it for whatever they want. Now, of course, they're always careful because they're worried about insurance and things like that. That's a whole different discussion. But the thing is, real world data is already becoming the big thing. And if you look at the paper I have, you'll see where journal articles now are saying the so-called gold standard double-blind tests with placebos and so forth is not necessarily the gold standard for this new technology. And so that's the sort of thing we need to let people in the policy world know about. And that's what I'm going to be trying. That's what I've been trying to do the last 2 years with meetings on Capitol Hill. And I think we have a real opportunity coming up to do that. One of the reasons, by the way, I wrote a piece for The Hill, which is a newspaper that goes up to Capitol Hill, obviously, and other places in the DC area, a little over 2 years ago. And it was Joe Biden, this was before he was a candidate, has his cancer foundation because his son died of cancer. And they just had their conference here in DC, and it just happened to be the 10th anniversary of my brother dying from cancer. So it was something that was on my mind. And so I wrote a piece for The Hill, and I said, Mr. Biden, I'm completely in agreement with you about what can we do for this terrible scourge that takes so many people, your son, my brother. But the thing is, you're talking about a moonshot, meaning let's throw a lot more money at it. It's not just throwing a lot more money at it, sir. It's what can we do to create a system to allow innovators to try new things that would hopefully not only deal with cancer, but all the other illnesses. Unfortunately, I didn't get any response. I sent it to his cancer group, and I never got any response. I don't know whether it's because things become partisan, but I think we have an opportunity now to make this a bipartisan, nonpartisan issue moving ahead.
Yes.
Yeah, Liz, you were.
Yeah, I have a question. So one of the things that people don't know unless they try to actually get a drug accepted by the FDA to be trialed is that unless you have evidence that drug might work, it's very difficult to get a grant. It's very difficult to get the FDA to approve the drug. So if you're looking at, let's say, a dual gene therapy, let's say one of the genes is telomerase, which has shown in some studies to reduce tau tangles, but it's a small study. But because of this tau tangle and beta amyloid plaque theory, even though yes, that's a downstream effect of Alzheimer's, if I mean the FDA gets so funneled into
Mhm.
treating a symptom of a disease. So now you've got an idea of let's regenerate brain cells, let's create better microglia, let's clean up the mess, let's regenerate
Mhm.
neurons so they function. Well, they say there's no evidence behind that. So, and then even now we heard back from a grantor that said that for a grant that we had in a study that we're doing at Rutgers University that we want to translate to human drugs, that aging in mice does not relate to aging in humans. So it's not a good model for aging in humans. So it's like they'll just take anything and just throw it out because they just stay on the track of the things that are already being chased. So if we had a drug and we thought we could reduce beta amyloid plaques, we could get accepted tomorrow. What are we going to do to change that? Because innovation is more than having good ideas and it's more than having good animal data. You actually have to have a system that will accept treating a disease in a different way.
Mhm. Yeah. But by the way, it's a very good observation that it's not just FDA, but in a sense, the whole mindset, you find it in foundations, unfortunately, and you find it, in many areas. And so, do we want to take a risk on this? And by the way, some of the folks I've dealt with, are, working on some of these products and have the exact same complaint that you bring up. Uh, Part of it, by the way, there's also a sort of an issue of what I call an iron triangle in sort of political terms. What that means is you have legislators who have a sort of certain interest. You have interest groups that support the legislators support the bureaucracies support the private groups that are benefiting from the regulations or whatever it is. And so you have this iron triangle, and usually um, lending organizations, for example, and so forth, who probably are getting some government grants or whatever, are sort of tied into the system. It's interesting because when I was working at the Cato Institute, this was in the late 90s, I had put on a successful space conference. I put on successful conferences on reforming the Postal Service. I wanted to put on a successful conference about reforming the FDA. So I decided to go to some of the big pharmaceutical companies to see if we could get some money to do that. And there were a couple that were actually, I think Eli Lilly was supportive, but a lot of them would say, well, Ed, we really do have problems with the FDA, and we really think, thank you for coming and seeing us and so forth. And they never gave us any support. One of the reasons we sort of determined was that big companies can afford a lot of the regulatory costs. The small companies can't. So, okay, I know you're going to be hitting me and it's going to hurt me, but guess what? It's going to knock out my competitor here and here, or my competitor is going to come and say, "Can you buy me up, please?" And then, and that's what, happens. So you have all of these institutional things that kind of work together, and that kill innovation. And that's one of the reasons, by the way, and this is something I should probably, maybe, I guess I've got to do this paper after next. Maybe I'll do it on that subject, is looking at the institutional problems of, uh, you know, where the money comes from. If I thought that even me, hardcore libertarian, we're told that an extra $5 billion and taxpayer money, and we could get rid of cancer, we get rid of Alzheimer's, we get rid of fill in the blank, I'd be there. Okay, I'd say fine, it's better than what the government does with most of its money. But that's the thing; it doesn't seem to be just the money issue. I'd like to see all that money go to someone like Aubrey de Grey or someone like you. But we got to. That's
Yeah.
part of the look at, is where the money comes from, how it's financed, and how is the system warped so that you can't get the grants. That's a very good issue. I think, Dan, you wanted to say something.
Well, yeah. Well, first of all, I'm really, uh, I'd like to work with you on this Human Achievement Alliance, so we can talk about that and,
Sure.
maybe build up a group of people here in the DC area. And I've been taking notes because there's so many interesting topics that have been come up that I think I should follow up on. But going back to, something you said earlier and again here, I think it's interesting to compare what happened with the the space industry to the biotech industry. It does seem that there has been more acceptance of risk and more that startups have that's sort of the entrenched system has been that was sort of politically corrupt has been broken, and now we see they are welcoming startups into the space industry. And you mentioned that in the 90s there was a lot of lobbying and people on Capitol Hill advocating for privatization of the space flight.
Mm-hmm.
But we haven't seen that so much. It seems like we haven't seen that so much for biotech.
Mm-hmm.
And I think this point you just made is maybe explains some of that, which is the this concept of regulatory capture that the really big companies have a vested interest in kind of maintaining the system because they know how to operate in it. But I'm wondering, is there any initiatives to start some kind of push to help small startups and innovative startups in biotech?
You mean like loans and things
like BioViva, for instance, or any there's a lot of these now. I mean, it was just said it's really hard for them to get these initial say grant funding or SBIR perhaps, and then later on it's harder for them to complete the trials and such. But is there any way of are there any initiatives to help support those kind of
not any big ones I know. I mean, one of the things with space is that you had a very defined goal. It was basically to get stuff from where we're sitting now up to 120 miles or however far the thing was, to get people or stuff there. And so it was a fairly defined goal. And then there were lots of sort of mini goals about satellites and things like that. And Space Hab, for example, had a system that they could put stuff on the shuttle and package it, and that sort of thing. So it was a little bit more of a targeted issue. And so when space geeks like me came along, and some of our friends at Space Frontier Foundation, I've worked with them. I'm sure a number of you guys have as well. It was easier to say NASA should be contracting out for services, which
and if I might jump in, also you had at that point it had become clear the shuttle program was a massive boondoggle.
Exactly. Yeah.
So,
and it was kind of realized like that. Whereas this is a much more, first of all, it's more complicated because you do have the FDA regulatory thing. It's a big one. You have the big companies that have vested interest in making sure that Liz doesn't become too strong and doesn't become the Steve Jobs against IBM, right? The IBM version thing. And you also frankly we're talking about the financing. That's a big problem too, because remember, much of healthcare costs is covered by Medicare, Medicaid. And so there's a whole financial issue there that's a complicated mess. And I'm not going to go into it all here because everyone's eyes are going to glaze over and we'll lose all of our viewers. But it is a major issue as well of what Medicare will or will not pay for, what kind of authority they have to do certain things. And again, I know this because I've been spending the last couple of months, at a hospital with my dad, trying to sort all this mess out. And it's just, it's kind of a nightmare. And so you have that whole problem as well. And by the way, there's a lot
That
of
seems like, the dominance of the importance of Medicaid, Medicare acceptance. That seems like something that would invite corruption, or some kind of, because you have the government holding sway over vast amounts of money.
oh yeah,
Like that would invite lots
yeah.
of corrupt lobbyists coming in and trying to
Oh yeah, I mean, there are, for example, um, there was a regulation I looked at couple of year or two ago. I don't know if it's been changed or not, about how physicians are compensated for what they prescribe to certain patients, and if it's a percentage compensation, then okay, let's see. Here's a drug that costs $50, and here's one that costs $100. Let me do the math. Well, if I prescribe this one, I get a bigger chunk of change under, I think this was under Medicare. But so there's actually incentives in the system, to do that. There's a whole coding issue, and Liz probably knows about this better than I do, about what doctors are allowed to code. If it is determined that this is your ailment, then this is how I have to code it, and this is what I can do. There are things where, for example, hospitals are, very much under these sort of regulations. And if, like, let's say you go into a hospital under Medicare, this was, I know, the case some years ago. I don't know if this has been changed or not. And the regulation is that, well, you have this, it's coded this way, this is the ailment you have, we will give you 3 days in the hospital. Okay, Medicare will pay for that. And then let's say the patient says, I'll tell you what, I'll pay out of pocket for another day or two. Okay. The hospital can't say, okay, fine, you're paying us. The hospital has to say, I'm sorry, I can't do that, because the Medicare regulations say that I cannot go outside of the Medicare system and literally take money from you that doesn't cost the taxpayer anything. And I know that at least a few years ago, when I was looking into it, that was one of the regulations. And again, this gets into the whole bigger issue of healthcare. Or since Dan, you and I are both here in Montgomery County, right? I think you're in Montgomery County with me. There was a Congressman, Delaney, who's a Democrat. I don't think he's in office right now, or is he? I forget. Anyway, and he was one of the debaters at the Democratic primaries. And I don't know if you remember the debate, but it was very interesting, because they were talking about Medicare and things like this. And he pointed out that Medicare tends to cover only 80% or something like that of most hospital visits. Therefore, how does the hospital make up for that? They charge everybody else in private insurance the extra 20%. And so there was a whole issue going back with Delaney. I haven't talked to him about this, but the point is, it's a real big mess. And one of the things maybe I can do as I move ahead, I'm working with some other groups that, on these kind of things. And again, maybe with, number one, we have a new administration. We know where the future is, politically. It's going to be less partisan, because I think if the Republicans could, continue to hold the Senate, and they've obviously made gains in the House, but we have the White House controlled by Biden. I think the incentive is going to be, okay, let's work together now. And what can be more important, and certainly of personal interest to Joe Biden, than work on this issue? So I really think we have an opportunity to say, we've got to sort this stuff out. We've got to get beyond, what, the rhetoric, and simply ask, what are the problems with the system, and what can we do to make it work better? And that's the FDA is going to be right in the target. I mean, remember, literally in the middle of March, again, I told you guys the story before, that I was literally sitting at the FDA headquarters at the end of February, just before all of this broke, saying, I'm getting reports that you guys and your regulations are holding back labs that can produce test kits, that can produce all these kind of things. And then 2 weeks later, they had the big press conference where it said, here's what we're going to be doing, because it is a crisis now. And if you go down the list of what was being done, it was basically, we're going to suspend this FDA regulation. We're going to suspend this FDA regulation. And it's like, okay, well, if you do that so that, my dad won't die of COVID, how about doing that so that all the other hundreds of thousands of people who are dying from other stuff won't die? Okay. So I think we really, with the, the problems with the FDA, I think we have an opportunity coming up. And I hope to work with you guys. Liz, I want to talk to you. I want to talk to a lot of other folks who are literally on the front lines to say, look, we're all agreed on this. This isn't Republican or Democrat or liberal or conservative, right? We all want to live. So let's get beyond the rhetoric and let's look at these actual things and, start making,
right. Just to jump in on that point, the failure of the FDA to rapidly approve certain tests is now widely acknowledged as contributing to the spread of or the inability to the United States to contain COVID-19. Especially like if you compare South Korea with the U.S., where both countries had their initial cases around the same time. South Korea was able to do huge amounts of testing and contact tracing and deal with it much better. Whereas in the U.S., unfortunately, there was I don't recall the details, but there was a specific test that was delayed several weeks because of some issues with the samples being contaminated or something, right? But that's something we can probably point to that
No, and as I say, and this dovetails into, it's not just, yes, we want to, we want to do something about COVID, but it dovetails into, look, let's use this as an opportunity, not just to deal with the pandemic. Let's use this as an opportunity to understand that if we have more breakthroughs and if we give the attention that Operation Warp Speed is supposed to be doing for the pandemic, then we can do this for cancers. We can do this for Alzheimer's. We can do this for Parkinson's. We can do this for all of these other things, and go even beyond any particular ailment, but getting down to the fundamentals, like Liz is trying to do, and Aubrey de Grey is trying to do, and David Sinclair is trying to do. That if we get to the even more fundamental level, we really will go from having a sick care system to a healthcare system. And to me, by the way, Janani, in terms of sort of something that sounds politically cool, and for the Transhumanist Party, and you've heard Peter Diamandis always says this, we could say we want to go from having a sick care system, which we have today, to a real healthcare system where we don't have to worry as much about my dad or my mom or my whoever it is, your friends and neighbors or yourselves being in hospitals. And shouldn't we make that one of our major goals? And I don't know who's going to resist it. Though, well, actually, there will be people who resist. As I say, I have a lot of quotes from people who say, well, the world is too populated and da 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 da. But when it comes back to most people, by the way, sorry to be partisan here. Okay, I've been trying to be bipartisan and open and all this kind of stuff. But Ezekiel Emanuel, who is one of Biden's chief advisors on healthcare, and specifically on the pandemic, I posted an article that I did. I think it was also for The Hill or Red State. I forget which one. Anyway, this was a while back, and he wrote a famous article in The Atlantic where he said, "I hope to die when I'm 75." And he is very specific about saying, if there's a pandemic flu, for me, no flu shots. And he quotes favorably, I think it's a British thinker. I don't know whether I call him a thinker. It sounds pretty stupid to me, frankly. It basically saying that some kind of pneumonia and flu and so forth is a good thing because it takes the elderly and it takes them quickly. Isn't this nice that all these elderly people are dying? And as I'm sitting here literally on the phone with my father trying to save his life, and when I read that and I say that this guy is advising Biden on medical issues, Joe, I respect you. You know, I know you want to really cure cancer and all, but get rid of this guy. Come on, you got to get someone better. Okay, sorry for that. My
Yes,
partisan thing.
actually, the U.S.
Yeah.
Transhumanist Party is planning to issue a statement about Ezekiel Emanuel. It
Good.
is in the works. Hopefully, we will have it available within a few days. But also, our friend Steve Hill from LEAF, the Life Extension Advocacy Foundation, published an excellent article titled "Why I Hope to Be Alive at 75," and that is a direct
Excellent.
response to Ezekiel Emanuel. I've also posted a link to that article in the chat for those who are interested to see it. But this is essentially at the root of the conundrum we face, in that there are mixed ideas in the mainstream political realm. On the one hand, I do think Joe Biden is genuinely sympathetic in terms of his desire to cure cancer, and he has certainly attracted a lot of money to the field. On the other hand, he's appointing people like Ezekiel Emanuel, and there seems to be more of an enthusiasm in his administration for lockdowns versus the approach of rapidly distributing vaccines. And as we transhumanists know, the widespread distribution of a vaccine against COVID-19 is what is going to put an end to this pandemic. So my question is, in framing this bipartisan approach, what can be done to speak to the good sides of each politician's, each political party's stances, while at the same time sending a firm message that certain approaches are counterproductive? They are not based in science, or they're based on an incorrect ethical framework, like any framework that thinks it's acceptable or desirable for some people to die just because they've reached a chronological age is anathema to transhumanism. So how do we disentangle the good from the bad and shift both political parties in the direction of supporting longevity, supporting scientific progress, and widespread availability of new treatments?
Well, I think the good news, by the way, is that, as I say, I look at where opposition comes from, and you'd think you'd get a lot from what I'm going to call the sort of religious right, you know, people who say, well, it's tampering in God's domain. And there's some of that. But again, I look at this Pew survey, for example, I look at other data, and I find that it's not that strong. Most people, if they're Christian, I know we have a Mormon transhumanists and you know, all sorts of other folks. You know, when it comes down to it, you know, when they say we can do the following, you know, and it's going to save your life, most of them will say, yeah, let's go ahead and do it. Okay. So I'm not finding as much resistance there as I'm finding it from, again, some of the people who are concerned that we have overpopulation or inequality. Well, you know, what if happens if more rich people get the medicine than, you know, poor people? I say, well, you know, they're beta users, by the way. But even so, you know, that's one of the responses. And again, if you take a look at Moore's law, you take a look at what's happened with just sequencing a genome in 2001 cost $100 million. 2007 it was $10 million. Today it's about $1,000. That's far, far better than Moore's law. But what I find also, and this is to the point you bring up, that this Congress is going to be more moderate in the sense that they're not going to be listening to what I call the sort of crazies on the far left, because you know they were expecting to get, the Democrats were expecting to gain a lot of seats in the House. They lost 5 to 10 seats. They're not sure how many because they recounts and all that kind of stuff. And a lot of the seats were, you know, because suburban folks said, hey, we don't like the radicals, burning cities, all this kind of stuff. But the point is, it means that they're probably going to be more reasonable and not listening to some of the extremes. So I think we're going to have an easier sell. And partly also it's because who has really made the case in the way that we're discussing right here? I haven't heard anyone. And so I think that we have a unique selling point. I know that I can name members of Congress whose offices I've sat in and talked about the, you know, parallel track approach to FDA. who were willing to sponsor legislation on that. I know that Senator Ted Cruz, he's interested in some sort of a reciprocity law that basically says if it's recognized in any advanced country, if Japan recognizes it, it can be used in the U.S. It doesn't have to be labeled, Japan, tested. And if it's done here, and then the Brits want to get access to it because it's not approved there, a reciprocity approach. There's some issues with that, but okay, fine. It would be an interesting approach. The point is, I certainly see that on the Republican side. And for example, I'm drawing a blank here. Who's the senator from Arizona? Sinemath. Anyway, she's a woman, senator from Arizona, who supported right to try. For those of you who don't know, right to try was actually something passed by the states. The states basically, state by state, 42, 43 at last count. So this is not just Democrat, Republican. Basically, it says for terminally ill patients, if the manufacturer wants to allow you to use an experimental drug, you have a right to use it, and we're not going to prosecute you. Now, essentially, all of the states were saying, whatever the FDA says, we don't care, you can use it. So they were all basically, going against the FDA. And what happened was when that was passed by the Congress, Republicans and Democrats, and signed by the president, by Trump, essentially all it did was say that we recognize what the states have done. Okay, and so this is and now, by the way, it's been used very, very little for a number of reasons. First of all, if you're almost dead, it's kind of like, it's kind of like it's too late for most people. And also, interestingly, manufacturers, we have some suspicion that manufacturers will not release the product because it'll screw up their statistics. What happens if they release products to a bunch of people who are terminally ill and they're going to die? And well, see, the product didn't work, did it? So, but anyway, the point is there's been bipartisan interest in right to try and bipartisan support, including from an Arizona senator. So I'm seeing now that we have these pockets that we can reach out to and, basically get something bipartisan. Now that hopefully with Trump is not in the White House, a lot of the partisanship will not be as strong, or at least the House is going to have to work with the Senate. They're going to have to work with the president. And by the way, this is another thing, if you want to talk about a political strategy. North Carolina and Texas, both last year or earlier this year, I think it was, looked at expanding right to try from terminally ill patients to, I forget what the exact legislative wording was. Essentially, it was to say a lot more people can do this. Now, Texas didn't go through with it because they have a session only every 2 years. North Carolina, I forget where it is in North Carolina, but the point is you have some opportunities at the state level to interest state legislators in basically saying, well, we essentially told the FDA we were going to do whatever the hell we wanted to do. And Congress ended up saying, yeah, go, that's fine. So you can even work at state levels to do that and to get state legislators to say, we are going to stand up for the interest of our people, and we're going to recognize maybe this, free to choose approach. And it's going to put pressure on Washington. So I really see some opportunities to put together a coalition and to appeal. So again, I don't think anything, even though I've been talking about Republicans and Democrats, nothing I've said here is necessarily, oh, well, only Republicans will like that, only Democrats will like that. Because again, right to try was passed by Republicans and Democrats in 42, 43 states. So again, I'm really optimistic if we can get together the right coalition and the right people. Imagine getting, again, this is my kind of fantasy, which probably says something about me, I suspect, is my fantasy is imagine having hearings on Capitol Hill or one of these sessions like we had for space policy, and you have Aubrey de Grey there, and you have David Sinclair there, and you have Liz Parrish there, and you have all these people there, and the staffers all going, wow, is this possible? Or members of Congress going, what, is this possible? And then the media starts covering it and saying, what, is this possible? who is this guy with a weird beard? Can we get him on the show? Can we get him on? And you have CNN and you have Fox all biting to get these guys on. And CNN likes it because he looks like a hippie, and Fox likes it because, well, he's all for these cool things. And so again, that's I think strategically, and that's kind of
I
wouldn't it be cool?
Question on high level strategy, which is, would it be, have you thought about, or have other people thought about framing, encouraging innovation, not broadly, but specifically in biotech, and also I'm thinking like germline genetic engineering, quite frankly, as a matter of national competitiveness, because we see right now like AI is benefiting a lot or there's a lot of interest in AI among the government officials because it's viewed as a matter of national competitiveness, specifically with China.
Yeah.
Could we do something similar for genetic engineering? Because it seems like in China they're going full speed ahead with, using CRISPR in humans and such.
Yeah. Actually, that's a good approach. That's a very interesting approach from the competitive angle, because I've written a lot about competitiveness going back decades, not just in this area, but in other areas. I'm an internationalist in the sense that I believe in free trade and open discussion and that sort of thing. But for example, China, I was one of the people. I was a good hardcore anti-communist, still am, and I was very happy in the late 70s when the Chinese decided to try a free market approach. They had probably killed 50 or 60 million of their own people, mainly many of them starving to death as well as murdered. It was just a horror show over there. And they decided after Mao Zedong fortunately died. By the way, Steven Pinker in this book says one of the best things that happened for China is Mao Zedong died. And I completely agree with that. Well, what happened after Mao Zedong died is Deng Xiaoping and some of the others said, we need to set up a system that allows innovation and so forth. And they did. And, while you still had to sort of don't get involved politically, because the communists still rule, they did allow that. And of course, you see what a success it has been. And I've always been look, I'd rather deal with successful countries and I'd rather see this kind of progress and so forth. But unfortunately, you all know what happened the last year or two, both not only with the way they mishandled COVID, but you see what's happening in Hong Kong. You see what's happening with throwing, dissidents into concentration camps and so forth. So now it does kind of become an issue of, okay, we would love to be partners and I'm all for that. But now there's kind of a competitiveness angle there that, we want to still be the ones, the United States and the West in general. We still want to be the dominant ones. And by the way, I think we would still be in any case because, what I'm worried about is that they're going to kill, their entrepreneurs if they keep this up too long. And they're going to kill the creativity in their own country. But I think it's an interesting approach. By the way, I did a piece some time ago because there was some kind of a cancer test in China that looked very, very promising. And there was a case, I think, I think it was an American who had to go to Canada to try to get this particular treatment or looking at it. And I wrote a piece about how the next congressman who gets this form of cancer might have to go to China to get treatment. And it was kind of a way of saying, do you want to fall behind the Chinese in this area? Japanese, by the way, the Japanese instituted for biologics this system. And I've got a paper on the Human Achievement Alliance website under the medical issue. I did a paper on that. So the Japanese already are doing this. Now it's limited for a number of reasons, but the thing is they've already adopted this idea of a parallel track. So
whatever we record that is not live streamed. Oh, the video is down too. Interesting. So we're back. Okay. So now I would like to ask the audience to continue posting whether or not you're able to hear us. And if you can hear us and see us, let us know. We're going to continue the discussion here. Thank you for your patience to everybody who stayed with us during this technical interruption. I wanted to highlight a few of the comments from our viewers because they've been quite engaged here throughout the discussion. And one of the comments from Daniel Twett is really a matter of common sense. He points out that there are many unexplored pathways to encourage genuine progress using cooperative and voluntary free market mechanisms, in his opinion. And I think a lot of the discussion here focused on how to encourage this. And he also points out there's entirely too much glorification of death and dying. And this is a problem with Ezekiel Emanuel's point of view as well. And some of the, let's say, more of the left-leaning environmentalist types who think that humankind is a cancer on the planet. Ann M. writes, we need a movement dedicated to longevity promotion as morality. And Zach Richardson expresses agreement with this. He states that morality informs culture and politics is downstream of culture. Mike Lazine says, I would think people in both parties would want to live longer to stay in the House and Senate if they choose to or have that as a true option. So that kind of appeals to the self-interest of the politicians. And who wouldn't want to live longer and enjoy whatever benefits they're enjoying in life? But John Halloran responds that that's too logical, Mike Lazine. So he seems to suggest that there are some irrational aspects to many people's mindsets that are unfortunately stymieing them from recognizing the benefit of these kinds of reform approaches. So for those USTP officers on the panel, let's hear some of your thoughts on this idea of a moral advocacy of life extension, which we, of course, have been putting forward for many years, and opportunities for getting that to permeate within the culture. It does seem to me that if in the broader culture, life extension is seen as a moral priority, the regulatory reforms will come, the funding will come. It'll just be a matter of time and overcoming the specific obstacles. But how do we get that realization to occur for many people in the way that it has occurred for us?
It seems like a lot of these politicians are always perpetually behind the times. So you remember you had that guy talking about how the internet is like a series of tubes, and they're just and you read about a lot of these politicians like Donald Trump or Hillary Clinton, like they don't even own a computer, like so I think we need to not count on politicians to be up on the technology. They're just not there, but work through other channels. So like one of the things that's kind of inspired, it made me a little more optimistic, is I see like certain YouTube videos have gotten millions of views. So for instance, there's a channel called CGP Grey, and he has a video about Nick Bostrom's Fable of the Dragon Tyrant, and that's gotten like several million views. And then you have the blog Wait But Why, and he's done some articles on why we should be pursuing life extension. So those kind of things have seemed to have gotten traction. I think mainly with, I suspect mainly with the younger generation that's perhaps more open-minded. And that's where I see progress being made. Unfortunately don't see much progress being made in the political sphere, although I definitely support, the work Ed is doing, and
Yeah. Politics is usually a following edge. And that's why I'm sort of, if you look at the website, humanachievementalliance.org, you'll see that it's, it really is trying to work the synergy between culture and values and so forth, and then using the needs to reform the education system, the FDA, and so forth, as kind of leverage points.
Right. So yeah, I like how you
Yeah.
start with culture and education as the foundation.
Mhm. Yeah, I
Because
mean,
that
yeah, I
is
mean, yeah.
things. That's where technological development and innovation comes from. It doesn't come from government decrees and such. But that's where the government can play a role in educate. Obviously, the government's involved in education, but
Right.
also
Yeah, I think we're right as far as,
Yeah.
government following behind what people are willing to vote for and willing to pay for. Edward mentioned earlier about where he was at in school when Apollo 11 flew. I was actually a freshman in college when Apollo flew, and Apollo was cool, and that's the point that I want
Yes.
to make. It was
Mhm.
cool, and it set me off onto discovery of. I had always been interested in technology, but that cemented the deal, and people were willing to pay for that as long as it was cool. But when it
Mhm.
quit being cool, the politicians went a different direction with where they wanted to go. So if we want to move these things along, I think with longevity, for example, it's got to be cool.
Mhm.
Perhaps what's cool is that the next major innovation is produced by a team that has people that are in their 60s or 70s or their 80s, and their background and their ability to innovate is somehow uh, made manifest and shown to the public that there's an advantage to being 70 years old. There's an advantage to being 80 years old. We have life experience that we didn't have at 50 and 40 and 30 and 20. I don't know if that's the right answer, but it's got to go something in that kind of direction. It's got to be something that people want emotionally as well as intellectually.
Yes. Mhm. No, those are extremely, I think, good insights. I mean, look, uh, I'm sure everybody on this call and listening knows the story of how the communications and information revolution occurred. And back in the 50s, computers were these big hawking things that only corporations, governments, and humongous research labs used. And who on earth would want a personal computer? And Steve Jobs made it just friggin' cool. Not just, yes, well, you have this nice tool that you can do all these cool things with, but it is just cool, and that's why he became a rock star. That's why he's, uh, everyone go to the website and see if you can figure out who all of these achievers are, because I have a link and it tells who all of these achievers are and what they represent. But yeah, it was just cool, right? And so you're right. Trying to figure out how we can make, I mean, I think not dying is all you need to tell me. Okay. Telling me that I will be around in, 30 or 40 years to see my wonderful 9-year-olds grow up and do incredible stuff is, you've already convinced me. Why people don't react to that, I don't know. But you're right. If you can make it just kind of a cool thing. And by the way, this is one of the things that to me, in a sense, is disturbing. But again, as I think that there's a thirst for this. When I look at what happened this summer, when I look at the fact that we've turned out a generation that is willing to go in the streets and loot and riot and burn, and not, I mean, if it's against things like police brutality, of course, I'm obviously for that. By the way, I was an elected official commissioner in Prince George's County, in a small town that was mostly Black and Hispanic, where I used to live. And during my time as an elected commissioner there, I served as police commissioner, and under that particular time, we had to fire 2 police officers, one black, one white, by the way, because we thought that having them on the force more endangered public health and safety than protected health and public safety. But because we were in an area of Prince George's County that was crime-ridden, what the citizens really wanted was to be protected. So this whole let's defund the police, it's like, kidding, but the point is this, that I was, it's very disappointing that you see so many young people who have their passion in going out in the streets and, about again, those are legitimate issues, but going out and doing violence and all, instead of seeing it as exciting to go into a laboratory, just like you found it exciting and I found it exciting after Apollo to, let's make this the future. Let's make this future. And so I'm hoping that, Zoltan did his book, and I found it a kind of a guilty pleasure. It certainly turned off a lot of religious people, I suspect, but things like that. And again, you look at the culture, you look at what was the movie Transcendence, the one with was it Johnny Depp and who else? I forget who. And by the way, I don't know if you noticed, but Elon Musk had a guest appear. He was sitting in the audience when the lead character was talking about this thing. But again, it's basically, here's what happens when AI goes crazy, right? And you look at all the art in the movies, and it's all AI is doing terrible things and robots are all killing us, right? And so we have that whole problem to look at. And to the
I want to
extent
go
that we
back to
Yeah.
the very beginning when you mentioned there's a problem in colleges, and part of
Yes.
that is the concern about offending people and the cancel culture and the wokeness and all of that, crackdown or the abridgment of free speech. But another issue is sort of this kind of anything that is perceived as Western cannot be promoted, because that is sort of imperialistic, or it's seen as a legacy of white supremacy. There's this move to decolonize certain subjects, but so is that an issue? Because because when we come out and say we support the Enlightenment and we support science and technology, that is sometimes seen as a legacy of Eurocentrism and colonialism, unfortunately. Whereas the whole point of the Enlightenment was these are universal truths that apply to all humanity, irrespective of nationality or ethnicity. And I'm wondering what your thoughts are on that, and what
I think you're
I
think you're obviously correct. Yeah, I think you're obviously correct that it's in the Enlightenment was not just we're the British against the French or the French against the British or whoever against whoever. It was this idea of the universality of humanity. And you could say, well, it took a while to spread, and that's absolutely true. But all reforms take a while to spread, whether it's abolishing slavery, whether it's women's suffrage, and I go through the whole list of what I consider to be real progress in respecting the human individual. And that's what the Enlightenment did. And in fact, it's because the Chinese and the Japanese and a lot of these other countries have accepted, I don't call them Enlightenment, even though I'm happy to use that term, and I usually do, and so does Pinker here. They're the universal principles that apply to humanity. Cicero wrote in his De Republica, there's not one law at Rome and another at Athens, but a law for all people and at all time, and that's right reason in accordance with nature. Cicero's a big hero of mine, by the way, and so is Aristotle. And so these are universals. And I think that the sort of woke culture that's promoting this kind of nonsense has kind of got slapped down politically, but unfortunately, they still dominate newsrooms and entertainment and civic organizations and corporate boards and politics and not all politics, obviously, and education and especially higher education. So the disease is still there, but that's why I think we need to, push back in a unified way. Again, you've seen what you've seen, and for example, was it about 4 months ago? There was a petition or a statement by, I think it was 153 mainly liberals. It had Noam Chomsky, who I'm not a fan of, by the way, Steven Pinker, who I am a fan of, and a whole bunch of others who are considered more on the liberal or the side of the spectrum, basically denouncing the cancel culture and saying, well, yes, we acknowledge none of us like Trump. Okay, fine. And, we denounce obviously police brutality and all those kind of terrible things. But, you have to have open discussions. You have to have open inquiry. That the thing that differentiates us from lower animals is we have a mind, we have a brain, we can understand the world around us, and we can make the world better for ourselves. That's what makes us human. And to give up that, to say we're going to cut that off arbitrarily, is, to me, you want to talk about what is the worst sort of form of evil. It's to not think. It's to consciously say, I don't want to think, I don't want to inquire, because all other evils, you might say, sort of flow from that. If you say, I'm not going to think, what happens if you get an impulse that you don't like somebody because of their color, race, sexual orientation, any of this kind of stuff? Well, if you've decided thinking is bad, then you just go ahead and join the Ku Klux Klan or something. Or if you want to do it on the left side, they have their own versions of that stuff. We absolutely have to defend, first, foremost, in the top of the list, reasoned, open discussion and these kinds of things. And unfortunately, the universities are the big places where you get the most opposition. They used to be if you look at civilization, and by the way, this isn't just Western. I mean, if you want to consider, I don't know whether you consider Islam Western, but the Muslim countries were ahead of European countries for quite a while in terms of learning. Baghdad was a great center of learning, and the Chinese had a tradition, with Confucianism and so forth. It was unfortunately too bureaucratized and so forth, but they had that in China. And you see, all civilizations have aspects of this. It's just that it happened, fortunately, that the European version really took hold. But I think fundamentally, as transhumanists, and for me, I'm obviously going beyond just the Transhumanist Party. All of us have to unite about that and say, look, the only way you solve a problem is to do that, is to think about it, to ask the kind of questions we've had. We talked about a lot of details about why is Baltimore City the terrible place it is. And it's not just that I throw up my hands and say, we got to throw more money at it, or it's because of Trump, or it's because of whatever. I say, we've got to use our minds to absolutely ask, how could this go on for 50 years? Something is wrong. Is it because Black people who dominate Baltimore City are somehow inferior? There's like zero evidence of that, like none whatsoever. So it must be something else. So what is the something else? Is it not enough money spent? Well, no, it doesn't seem to be that. Well, is it because they have a different policy for this and that and the other that keeps entrepreneurial people from forming businesses? Yeah, maybe it's that. What about schools? What about how the schools are run? I have a friend who is on the board of charter schools here in Maryland. They now have 4 of them. They had one in Baltimore City. And I can give you the statistics on the charter schools. And they do, and by the way, I've been to these schools, and it's mostly Black and Hispanic students at these charter schools. And their test scores and all that sort of stuff are far above those of the other schools in the various counties. It's mainly Prince George's County now. And I think they will have one in Anne Arundel. And they had a school in Baltimore City, and it was doing very well. And basically, they had to close it. They were getting driven out because the teachers union didn't like the competition. Even though, by the way, they're a state school, they're state-supported schools. It wasn't like and the people in the school are union workers. So it wasn't like they were kicking out the unions or anything. It's just that they had more, uh, uh, more freedom to put together curricula, things like that, and they were doing far better. And so their reward is, rather than saying, "Hey, why don't you run all the schools in Baltimore City?" The reward was, "We're going to do everything to get you out of the city." So anyway, I know it went off a little bit there, but the point is that that's how, I think the way we go after these nuts is we basically say to the people, these guys are nuts. We want to talk about solving the real problems, and then we focus on the discussion we've had, like right here.
Mhm. Yes, and in terms of freedom of speech, the U.S. Transhumanist Party has stood in defense of freedom of speech for a long time. We have two platform sections that were adopted in the spring of 2017, and I will read them to you. Section 20 states, "The United States Transhumanist Party strongly supports the freedom of peaceful speech, religious, non-religious, and anti-religious philosophical espousal, assembly, protest, petition, and expression of grievances. The United States Transhumanist Party therefore strongly opposes all censorship, including censorship that arises out of identity politics and the desire to avoid perceived offensive behavior." And Section 40 reads, "In addition to its opposition to intolerant interpretations of religious doctrines, the United States Transhumanist Party is furthermore opposed to any interpretation of a secular, non-religious doctrine that results in the rejection of reason, censorship, violation of individual rights, suppression of technological advancement, and attempts to impose certain beliefs by force and or by legal compulsion. Examples of such doctrines opposed by the United States Transhumanist Party include Stalinism, Maoism, neo-Malthusianism or eco-primitivism, the death acceptance movement, and the doctrine of censorship, now prevalent on many college campuses in the United States, in the name of, quote, social justice, combating, quote, triggers or, quote, microaggressions, or avoiding subjectively perceived offense." So this is a lot of what we discussed today in terms of the mindsets that are obstacles to progress and obstacles to embracing a techno-positive, techno-optimistic vision of the future. And we have this in our platform, essentially establishing us as a party that is pro-enlightenment, pro-rational discourse, pro-freedom. But I wanted to get your thoughts, Edward, on how it is that there is this young generation that is passionate, but it seems there's an undercurrent of pessimism behind that passion. So it's not passion to go out and do great things. There's this perception that the world is so fundamentally unjust that for some of these people, the only remedy seems to be just mindlessly lashing out and destroying whatever is near them, even if it has nothing to do, objectively speaking, with the evils they're trying to combat.
Right. Yeah. I mean, I think my short answer is that the left's long march through the institutions has succeeded. That, for those of you who know history, there was always these issues about, do we have revolution, as in, for example, the Soviet Union or other countries, or there was an Italian communist thinker and then later a German one who said, no, there's a more effective way to do it, and that's in the long term. You slowly take over institutions, and then you spread your influence from there, and that's how you do it. And I'm not saying this is a conspiracy, but I'm saying that the pattern was that a particularly pernicious philosophical strands, postmodernism being the most egregious one, became established in universities. Postmodernism, there's no reality, it's just the narrative. If you point out to a postmodernist, but look at these facts, and like just, we've been doing in this conversation, I've been saying, well, look at this fact, look at this fact. Well, that's not my reality or my narrative. In other words, postmodernism is a license to just pull it out of your butt, literally. And that's what they do. I hope I don't get her in trouble. My wife edits textbooks for a major publisher. the stuff she shows me is such crap. I cannot believe it. Um, and this is the stuff that's being taught in universities. It's the most insane, absurd garbage. And so what happens is you take generation after generation that goes to the universities, right? And a lot of them go into technical stuff and they probably have to take classes in this stuff and they just ignore it and say, ah, it's all garbage. I forget it. I'm going to go out and be an engineer. I'm going to go out and be whatever it is, right? But a lot of them take this whole narrative, this whole dogma, which is just as pernicious as communism and Nazism and, and so forth. And they've ingested this dogma and it's their defining way of looking at the world. And then what happens over time is, first of all, you get their graduates who now are in the media, who are now in the entertainment, who now dominate civic organizations, religions, et cetera, et cetera, et cetera, all these institutions. So you have that on the one hand. So they're continuing to do their indoctrination. And of course, you have the ones who basically get their degree in something that's pretty useless. And then they go out and they are frustrated because they're not getting jobs that are good paying jobs, perhaps. And they don't have, because they're not getting it in the universities, what they're not getting is what we're discussing here. Wouldn't it be great if you had a lot of professors who were, transhumanist professors, or let's say you had a lot of Aubrey de Greys out there at universities? Wouldn't that be wonderful? Or David Sinclair's at university? You do actually have them at universities, but not enough of them. Or folks who were more of the Enlightenment type at universities. Wouldn't that be great? Because then they'd be seeing, oh look, wow, this is possible. So yeah, we got these nuts over here in the sociology department, but yeah, we can kind of ignore them, and we can get into doing just like when I was at the University of Maryland. Space was a big thing. The physics department, the engineering department were very popular for that time. So I think it's basically because of what happened at the universities, and then what happened with them getting out into the general culture, that we have this problem. And again, where's the examples? Again, we had Apollo in my generation, and you don't get it in the university. You don't get it much in the popular culture. It's sad.
Well, we do have some examples in our era if people know where to look. For instance, Elon Musk with SpaceX is providing some inspiration. And also, if the COVID-19 vaccine can be manufactured, or vaccines, and distributed rapidly enough to end this pandemic sometime early next year, I think that would be seen as an example of science and technology overcoming a great and unavoidable social problem. Now, of course, the question is, how will people interpret that? And I see the evidence of a techno-optimistic future all around us, but it's a question of, what does one focus on? Does one focus on the prospects, or does one focus on the very real problems that exist in our society? And I do take issue with those who just focus on the problems. Now, one of the areas of greater curiosity that I wanted to elicit your thoughts on is your analysis of the outcomes of the election. And you mentioned there is more of a likelihood, in your view, that a more moderate approach to politics will win out. And from a transhumanist perspective, this is actually desirable, because instead of the left and right shouting slogans at one another and perceiving one another as irreconcilable enemies, there could actually be some cooperation on policy in areas where people would hopefully agree on, at least in their majority, such as improvements in the healthcare system. But I would like to hear more of why you think that is the likelier outcome, why you think these more strident voices on the left and the right, the woke left and the populist Trumpist right, are going to kind of fall into the background, because unfortunately they've been dominant in 2020, and they have caused a great deal of havoc and destruction.
Mhm. No, you're right. By the way, this was a pre-Trump book. It was about a year or so before Trump. I did a book on the Republican Party Civil War. Will freedom win? And I guess the answer is still up in the air a bit. And actually, this book, what I was doing was contrasting several strands, the sort of more libertarian freedom strand, sort of Rand Paul strand, with the more very traditionalist right, that tended to be against gay marriage and these kinds of things. Again, if it's your personal opinion, well, that's fine. That's your personal thing. Um, but the reason I see that, and I've kind of indicated this a little earlier, is I take first of all, one of the reasons I think Trump was elected to begin with, okay, was because despite whatever the rhetoric was on whatever side, a lot of people saw, for example, that their healthcare premiums were doubling and their deductibles were tripling under the Obamacare. And so you could say, oh, it's a wonderful thing and all. I was one of the people who's sitting down there looking at my numbers, and the Atlas Society, by the way, was saying, I don't know how we're going to continue to pay people if we're giving these benefits. Okay. That was the reality on the ground. Okay. And so, yeah. And plus, the recovery was fairly slow as recoveries go compared to past years, in terms of unemployment, in terms of a lot of other factors. And third, there was a frustration among sort of what you might call the Republican base on the fact that even when the Republicans took over the House, they really didn't do much of anything. And the feeling was that they were, Obama said, well, we lost, but I have my pen and I have my phone and I'll do whatever I want. And instead of saying, no, we've got some better ideas here, let's talk about them, the Republicans just seemed to kind of fade into the background. By the way, I knew Paul Ryan personally because we were both Hill staffers at the same time. So it's not that I necessarily disliked Paul Ryan. Okay, I personally know him and like him, but they really didn't do anything. There were some very good plans, for example, for real reform of the healthcare system, and because I read a number of them myself. But how many people on this call, much less the general public, know what those were? And the answer is probably very few because they just did a pathetic job, frankly. So a lot of the Republican base was looking at, okay, we're looking at our healthcare costs skyrocketing. We're looking at an ineffective bunch of, seemingly political insiders who are nothing but hot air and rhetoric. And we have this new guy who comes in and he's a bull in the china shop, and he's basically not playing by any of the rules, and he's saying, screw everybody, I'm going to come in, I'm going to beat everybody up and screw you. And they're saying, can't be any worse than what we've got already. So I think it was kind of that frustration that led to Trump being elected in the first place. And plus, Hillary just did a pathetic job of campaigning, quite frankly. Okay, and again, this is Ed as the political analyst, not Ed as the Democrat or Republican or whoever it happens to be. It's just, look, she wasn't a very attractive candidate. And, again, you looked at Trump rallies. I heard Trump in person. I don't know if you heard him when he was at Freedom Fest, Gennady. I don't know if you were in the room, but, he's a very effective speaker. I didn't agree with half of what he said, but he's a very effective speaker. So he was filling stadiums, and Hillary Clinton was, filling half of an auditorium that had to be blocked off so they couldn't see all the empty space. So that's kind of what happened. Then what happened was he had his up until the pandemic, the country was in very strong economic shape. Unemployment was low, job creation was very strong, stock market was up. There was better job numbers for Hispanics and blacks than had been for many, many decades. Some say in history. I don't know whether that was true or not, but things were in pretty good shape. I thought his policies on trade were not very good. China cheats all over the place, but I thought the way he handled that was not very good. The way he was handling actually drug pricing was not very good. And by the way, all the Republicans, libertarians opposed him on that. So I could go down all the list of the things that I disagreed with him on. Okay, there was a lot. But the thing is, frankly, his whole demeanor, his whole making fun of people personally, and so forth, simply offended people who otherwise might have supported him. And while I don't look up to a president as a great hero and all, I just want him to keep my, keep my freedom. He offended a lot of people, frankly, who he shouldn't have offended, and it was his own fault. And he made so many enemies. Now, we knew he was going to get enemies no matter what, but it's just that every day it was like he handed them something new. Here's something else I've done stupid, or something else I've said, so everyone can jump on me. Okay. And you did have the deep state that was against him as well. So you had all of those things coming up, and then the pandemic, just kind of blew it out of the water. And it's like, well, maybe you weren't responsible. It was on your watch, and you didn't figure out how to get out of it. And the election was still, but here's why I say that I have some optimism. The election was still very close. Everyone was predicting there was going to be a blowout. It wasn't a blowout. I don't think the recount is going to change any states. It could change Georgia. In Georgia, it could mean that the senator that it gets above 50%, so the Republican gets the Senate seat. There was a lot of cheating going on, but I don't think it's going to change the results. Okay, but the fact that it was a fairly close election, the fact that Republicans probably keep the Senate, and that the Dems lost seats in the House, I think is going to basically say, oh, and I think also the public's attitude is, oh gosh, haven't we had enough of 4 years of this throwing mud at each other? Can't we have something a little bit normal? And so I think with that sort of the public just saying, 2020 was a hell year. Can't we get back to something vaguely resembling normalcy? Then I think basically they're going to have to, the Biden's going to have to work with the Republicans in the Senate. So he's not going to be able to nominate socialist Bernie Sanders as labor secretary. He's not going to be able to put a lot of really radicals in there. And they're going to have, and a lot of Democrats in the House, frankly, are scared they're going to lose their seats next time around in 2 years. So they basically say, we want something that's a little more moderate too. So I think that's our opportunity. And you probably have already seen, in reports of some of the debates going on within the Democratic Party, where a lot of the, the moderates that are still there are saying, never, ever, ever say defund the police again. Just push all that nonsense out, because we want to solve problems and not show that we're a bunch of and stop talking about socialism. It's stupid and fails everywhere. And we're not socialists, we're liberals. We want a welfare state, yes, but we want to solve actual problems. So that's why I have some optimism for the current Congress coming up. I hope I'm right. We'll see.
Yes, thank you for this analysis. Now, of course, I think a lot of people observing the election results will agree that essentially Biden won according to the rules, and it does seem like the legal challenges that the Trump campaign is throwing up right now are being essentially summarily rejected, because there's not a lot of merit to them. And wherever recounts are being undertaken because the margin was close, the difference is not going to be enough to give Trump this election. At the same time, of course, Trump is refusing to concede right now, and he does have a lot of power in a propaganda sense, in the sense that many people in the Republican Party, even some who were reluctant supporters of his in 2016, are more enthusiastic supporters of his now. And it has been somewhat startling to me how quickly some of these people who might otherwise be reasonable have kind of bought into Trump's claims of electoral fraud, even though there's not a lot of evidence to substantiate those claims. So do you foresee in this transitional period, the 2 months prior to Biden's inauguration, the possibility of continued flare-ups and confrontations instigated by either the firebrands on the right or the firebrands on the left? And if so, could that derail a kind of moderate ascendancy, or would this just mean that people will want calm and civility to a greater extent come 2021?
Well, two things. By the way, because I was literally in on some of the meetings right at the election and just afterwards, there were election irregularities, especially in Philadelphia and some other places. But again, there's some places in this country that just are known for that sort of thing. So I think there really were election irregularities, but they're not going to make a difference in an election as far as I can tell. Okay. And I've kind of looked at each state. And again, some of them are they might gain a few seats here and a few votes here and there, but probably not worth it. I think it is an important thing in the long term to look at places like Philadelphia. Chicago's been known for their election fraud for decades. It's not a state secret or anything. But to your wider point, I mean, by the way, I just saw a news report a little bit earlier that Trump has essentially said Biden won. So Drudge posted it. I haven't read the piece, and I've seen it posted some other places. So after this call, maybe he has conceded. But anyway, but to your wider point, I mean, right down in Washington, D.C., which is some subway stops down from right where I'm at right now, they had a bunch of MAGA demonstrators. And so the people who were enthusiastic about Trump really were enthusiastic about Trump. So in a sense, your question is, so what happens to those people in the future? What are they going to do within the Republican Party? I don't think Trump is going to run again. But by the way, here's my weird prediction. And you can all say I'm nuts, and I probably will be nuts. It's possible that Trump could step down before the inauguration. Pence becomes president, and then Pence does a Gerald Ford and pardons Donald Trump for any perceived crimes, because he may have done some tax stuff, but the most of the other stuff is just not held water. But just to keep it from going on and on and on, I think there's a possibility that Pence could become president, pardon Trump, knowing he's going to be out anyway, and then say, "See, I've done a favor for Joe Biden. So instead of Biden having to have all of these other distractions going on, we can all get down to business." Okay, I predict that. So I may be wrong, but here's the other thing. Part of the challenge for the Republican Party is going to be how to channel that energy and support for Trump into other things, rather than just becoming the equivalent of, Antifa, though maybe not as violent as Antifa. Antifa just basically going out and breaking things and screaming and yelling, and they have no constructive program at all other than tearing down statues and beating people up. What's going to happen to those Trump supporters? And is the Republican Party going to figure some way to say, okay, we understand your frustration. We understand, but you have to say, okay, what are the legitimate issues that we have that we supported Trump for? And how can we work to move those things ahead? So if you like the fact that we had a strong economy before the pandemic and lots of job creation, well, let's talk about that. And maybe we can find some of these Democrats who kind of got burned because they didn't take over the Senate and they were weakened in the House. Maybe we can work with some of those guys. What about some of these things? That's going to be a real challenge for the GOP. The other thing is they don't have any obvious next leader. Pence is, he's a nice guy, he's a smart guy, et cetera, but, he's not Mr. Dynamic, okay? Whether you like his policies or don't like his policies. Rand Paul, possibly, more of a libertarian Republican. So, he's someone who's possible. But the thing is, you're really going to need a few Republican leaders to figure out how to challenge that energy. Otherwise, you're right. It's going to be kind of negative energy. And at some point, the Dems just say, look, you guys are nuts. And they're able to ignore those folks because, maybe the general public will say, look, you had your shot. Your guy didn't win. You got to, start focusing on issues rather than just kind of demonstrating. And so what I would hope is that the Republicans could basically find some way to channel their energy and, into some constructive stuff that may or may not be in agreement with Biden, but would be at least focusing on an issue.
Mm-hmm.
So
yes, thank you, Edward. And we have a question from Mike Lazine, who wrote, "Too bad the Democrats and the GOP don't invite more transhumanists for their discussions or hearings. How do we change that besides the obvious?" And you mentioned the vision of Aubrey de Grey and Liz Parrish and David Sinclair being present at a hearing on Capitol Hill. So how do we make that a reality? And in this new political landscape, what can be done to get Democrats and Republicans, despite all of their differences with one another, to say we can agree on the issues of improving the healthcare system, improving human longevity, improving human well-being enough to at least give the transhumanists a voice, give them a platform to express themselves within committee hearings or other venues.
Right. Well, I mean, that's kind of what I want to try to do, and I'm raising money for this. As soon as I get my paperwork all done for the, I'm a registered nonprofit in the state of Maryland. I'm trying to get, hopefully next week, send in my, IRS stuff to get the tax-free thing, and then raise the money to do this. But that's exactly the sort of thing I would like to do, and where I think I have some inside, because again, I know some of the members of Congress. I know some of them. By the way, the one I was speaking of from Arizona is Christian Sinema. That it's not McSally. That's the one that lost. It's McSinema, who was very much in favor of the right to try, for example. And so, and I tried to get meetings with her when I was at Heartland to talk about this, and they just never got back to us. I have a feeling it was just because things were so partisan, they weren't interested in this. But again, there are a number of members who we were able to get in touch with, sit down with, and all. Who now what I'm going to try to do is follow up, and see where is there still interest there, and start to basically do what we were doing for the last 2 years, for example, on FDA reform. And again, what I'd like to do is, if I can get the money to do it, is to do some of these things like we were discussing about what we did, and actually there's more other people organized this, but I was involved in space policy on Capitol Hill, where we would have every month or two sign out a hearing room, bring in some sandwiches and stuff, bring in some people to talk about these things, and get people, get especially staff on Capitol Hill, because often it's staff who tells the member, hey, this is really important. You got to look at this. Here's the papers, and here's the information, and that sort of thing. And so that's basically the kind of thing, to Michael's point, that I want to do with the Human Achievement Alliance, is to raise consciousness, not in some mystical, everyone's going to go chant stuff, but to raise consciousness about what is really possible. It's not science fiction anymore. And that's kind of part of my mission, and I hope to pull in anyone who's interested in doing this. And by the way, I'll also mention to Michael that there is an opportunity to do this at the state level with right to try, and basically expanding right to try, and just the discussion about expanding right to try, not just to people who are terminally ill, but to others, opens up the discussion of, well, look at this research being done by people like Liz, and people like Aubrey, and people like David Sinclair, and all. And so it's an opportunity to put this on people's agendas. So if you're in a particular state, you can contact me, and I've got, I know people who worked on these issues at the state level, and then maybe we can do something there as well. And remember, state legislators often are the ones who later become members of Congress, right? Or even senators. And so if you start doing it at that level, maybe it won't happen immediately, but maybe that woman or man, ends up saying, I'm going to run for Congress. And now they have in mind all that cool stuff that they got when they were in the state legislature.
Yes, and that is a great idea. The U.S. Transhumanist Party intends to focus more on legislative activism during the coming 4 years. One of our most important successes has been at the state level in Nevada in 2019, where we derailed an attempted prohibition on voluntary microchip implants. And instead, the prohibition became a prohibition against employers and government entities forcing people to have microchip implants, which of course would never happen to begin with, but now the law ensures that it won't happen. And voluntary microchip implants, such as the ones that many biohackers, cyborgs, including entertainers, various sorts use in Nevada, are perfectly legal. So we should pursue more of these pathways toward legislative success, including in reforming the medical system, allowing more patient choice. Now, on the subject of reforms to the healthcare system, I would like to pose one more question from Tom Ross, who is our Director of Sentient Rights Advocacy.
Tom.
And I know you and Tom collaborate closely on TAFTS, of which you are the Chief Operating Officer, and Tom is the President and CEO. So Tom points out that the so-called individual mandate that was part of the Affordable Care Act, aka Obamacare, and which the Trump administration actually enabled a repeal of, originated in the 1980s with the Heritage Foundation. And actually, to me, the individual mandate was the least palatable aspect of the Affordable Care Act, and it was the one that led many individuals into this conundrum that you described, where the prices of health insurance skyrocketed, the deductibles increased, and yet people were being forced to pay for this coverage. And a lot of people on the right were blaming it on the Democrats and Obamacare, but it does seem like they kind of imported this idea from the right-wing think tank sphere. So what would you say about that? What motivated that idea to come about in the first place? And how did it morph into essentially the disaster that it was?
Well, that's a really good question, Tom. And I was at the Heritage Foundation, it just so happens, around the time these ideas were being discussed. I think I left just before they kind of posted that particular one. But I was on the inside of that one, and it was controversial, by the way, at the time. What was happening is that Heritage was trying to come up with something that they thought would work to keep some sort of a free market approach. So you have to have health insurance, but you can get it wherever you want. So that way, and then if you need to subsidize somebody because they don't have the income or whatever, then you just deal with that as an individual matter rather than regulating the whole healthcare system and basically making it a mess when you can do a very simple thing. And it was a Heritage Foundation idea. In fact, I know the guy who came up with it personally. What's interesting is that maybe I'm wrong, but when I looked some years ago, all of it disappeared from the Heritage website. I'm not sure how that happened. I can find my 1989 or 90 piece on Africa that's still there. It's a wonderful study I did. I can find all sorts of stuff I did back in the 80s, but for some reason, it's not. I haven't seen it. But actually, there was another path, and that was Mitt Romney. In Massachusetts, Romney Care was essentially a version of the Heritage approach, and Obamacare was kind of a version of Romney Care, and that's one of the reasons why Romney lost is that he couldn't explain the contradiction between, well, you did this at the state level, so why not do it at the national level? And he came up with all this kind of stuff, but there was no way in 2 or 3 sentences he could say anything that sounded vaguely reasonable about this is why it's not a contradiction. I think it's one of the reasons why he lost. But that was the origins of the Heritage approach. And Tom is absolutely correct. It did not come from Bernie Sanders. It came from the Heritage Foundation as sort of we'd like a complete free market, but if we can't have a complete free market, why not just mandate that people have to have health insurance and they can figure. And by the way, actually, there is an interesting model or precedent that they were looking at, I believe. In this country, everybody has money taken out of their paychecks for Social Security. Whether you like it or not, it's taken out, okay? And economists who I've worked with and so forth have pointed out that, if, for example, going back to the late 1920s, if you took a 40-year segment of time, like the average work history, and you broke it up into quintiles, and then you looked at how much, the average would be. If you took that same money that it was taken out of Social Security and put it into like a S&P 500 indexed fund, in just about every case, you would get 2 to 3 times as much that Social Security gives you. And I don't think there's one case where maybe you fell below what was Social Security. Anyway, but the idea is that Social Security is mandated. And what you had in, for example, Chile with their reforms in Chile, the free market reforms there, is they required everybody to have a retirement account. But you could take that money that would normally go into the government, sort of Ponzi scheme, and you could put it into essentially a 401k or an IRA or something like that. And so the Chileans actually adopted that system. So it was a mandate. You have to take care of your own retirement. The government had been doing it, not doing it very well. So we say, okay, we're going to keep the mandate, but you can do it however you want, and seemed to be a pretty successful thing. So I think Heritage might have also been looking at saying, well, you have a Social Security mandate, and the free market approach might be better. Why not do it this way? So that's kind of your answer, Tom. You're right. It wasn't Bernie Sanders who came up with this idea.
Yes, indeed.
By the way, I want to say something just real. This is a kind of a personal issue about implanted chips. I'm going to be very reluctant to do that myself, mainly because I would not trust the government to somehow say, well, Ed, we've decided that we don't like X, Y, or Z that you do. So if you don't go to, our mandates, we're going to have a backdoor to go in and do something unfriendly with your chip. I just don't trust them as far as I could throw them. However, as you know, Gennady, we had a family tragedy last week in my family. My niece, 3-month-old baby, died suddenly. And it looks like it's SIDS. It's a sudden infant death syndrome. You can imagine. I was at the funeral, the other day, and I was thinking that, and it's one of these things that it wasn't like we knew she had a heart problem. We knew she had it's some sort of thing that you could at least say, well, is there medication? It's just she didn't wake up, and I was thinking, what if she had had a chip implant that could have monitored her, and when she stopped breathing, an alarm goes off and someone is right there. I don't know whether it would have helped or not, but it was kind of on my mind that there might be something that a parent could, basically be given the option of putting a chip in the baby that would alert them to any kind of medical issue, that would happen. I know that when we had our twins, we had the beds in the room with us, the cribs in the room with us, because we were very cognizant of this sort of thing. And we wanted to make sure if one of them stopped breathing or anything like that, we would immediately hear it and, have some sense of it. So, maybe there's something that you wanted where technology, in the future could prevent this kind of tragedy.
Mm-hmm. Yes, hopefully those kinds of technologies can be developed. And again, I extend my condolences on this very unfortunate death. This is what scientific and technological progress is needed urgently to prevent. And Mike Lazine in the chat also says, sorry for your loss. That is pretty sad. And I will say, based on my conversations with the biohackers who are adept at using these chips, the NFC RFID implants, today's implants don't actually have that ability for remote signaling. They can interact with a person's mobile phone in close proximity. But actually, one of the areas where we needed to educate the legislators in the state of Nevada was this perception that the chips could be used for some sort of remote monitoring, that the government could surveil individuals. In fact, it's a lot easier for the government to surveil individuals using their mobile phones, because you do have the ability to install backdoors on phones, track them via GPS, etc. Whereas with these chips, you have to have a phone essentially in this proximity with my hand hovering over the other hand in order to read the chip. And this is why essentially the legislators in Nevada ultimately became convinced, well, no, these tools can't be used for tracking or surveillance. You really have to have a person's consent to bring a phone close enough to scan that chip. And I think informing people of how various technologies work, what they can and cannot do, is absolutely crucial. We've discussed some problems with technological illiteracy among certain lawmakers, but it doesn't have to be the case. And indeed, some of the legislators were quite fascinated with these concepts, and it seemed to me they were introduced to a world they hadn't been privy to before. Mm-hmm. And the reaction was not hostility, it was curiosity. So that's a hopeful sign.
By the way, I want to add to that. Since I was at Heritage as well as Cato and other think tanks, the three pieces you'll see, my three pieces on FDA were done at the Heartland Institute. Part of the whole purpose of the Heritage Foundation, as well as these other places, was to do exactly that, to provide information to legislators, as well as other sort of public influencers and interested parties, and to do it in a way. I mean, we're very cognizant of audiences. There are going to be people like me who are going to read Steven Pinker's whole book. Or I have the audio version here, so I listen to it when I jog. So, and I do a lot of that. I listen to a lot of books now that way. There are going to be people who do this, or who read Peter Diamandis's excellent book on, the future is faster than you think. There are people who read books. Most members of Congress don't do it, not just necessarily because they're stupid or something, it's just that they're really very busy. So, for example, the Heritage Foundation, their founding purpose was to provide accurate, timely, and appropriately sort of short information called background. So it'd be 10, 12 pages. It had to pass the briefcase test. You can throw it in your briefcase, read it on the way to the airport. You got all the facts. It's all nice and neat. It's not written in jargon and so forth. And Cato did those as well. Cato tended to do a little bit more basic research, and you can see my pieces from Heartland on the FDA. But the idea was to provide that information in a manageable form, not only on particular laws, but just to educate. And for example, when I worked on the US, Mexico, and Canada free trade area. And when we started working on that subject, most legislators had no idea what a free trade area was. Does it mean everybody can come in from Mexico and Canada or whatever? No one knew. So the papers would start off kind of with elementary information. This is what a free trade area is. This is what a customs union is. The European Union started as a customs union. They did this. We did that. And then you got into more as people became educated, then you could talk more about how will this affect energy trade? How will this affect this thing or that thing? So there was a kind of education glide path. And one of the things I would like to do is something along those lines with some of these topics. There's a lot of people who've done very good work in some of these areas, education reform and so forth. I've done the FDA stuff. And to kind of have a glide path where you sort of have a strategy for raising consciousness, but also educating lawmakers, whether it's here, or whether it's in Nevada or wherever, on these topics. And again, I hope to be working with not only the transhumanist parties, but with other interested folks about doing that, so that maybe the next presidential election, this is going to be one of the topics that everyone is talking about. Wouldn't that be cool?
Yes, indeed. So now let us go around to each of the US Transhumanist Party officers on the panel for their questions, comments, concluding remarks, anything they want to address. And then, as is our custom, we will conclude with the last words from our guests. So let's go to Art Ramon Garcia. Art Ramon, what thoughts do you have to share with us?
Yeah, two thoughts. One thing I haven't heard discussed is the cultural resistance to, super longevity. And I think one of it might be generational wealth transfer. A lot of the wealthy families have got it fine-tuned. They're looking at the longevity of their bloodline. So super longevity might throw a huge wrench into that fine-tuned system that they have. So that's, one cultural resistance, I think, that really hasn't been discussed. Second, Space Force. Space Force does not have a JROTC program. You can create it. It's wide open. It doesn't exist. I just looked it up. Maybe if you can work with Department of Education and work it into the STEAM programs, maybe a JROTC program is the way to go to get some of your ideas in education implemented. So that's all I have. Thank you for coming.
Yeah, thanks. To your first question, I haven't done much work on this, but it has been discussed. I think Kurzweil discusses this, and I know that Peter Diamandis, I think, has discussed this, and others. But part of what I want to do under the sort of future economy section and issues is that when you start talking about people living to 100 and 200 and longer, first of all, the current Social Security system just completely breaks down. When Social Security was started, it was something like 14 or I think it was 16 workers per retiree. And so if everybody just chipped in a little bit, we could take care of all the retirees. Now it's something like 2.5 workers per retiree, right? And the retirement age is 60, whatever it is, right? What happens if, and the assumption is that most people after they retire are going to only live a certain number of decades, right? And of course, we do have IRAs now and 401k, so people can put their money aside to the extent they're allowed to do that. But if you're talking about living to 200 years old, that system is just completely blown out of the water, right? And so there's going to be a need for radical reform and a radical way of rethinking this sort of thing. Now, obviously, my thinking is, well, if I can live to 200 and be healthy, then I'm not thinking about retiring. I'm thinking about, how I can go to Mars with my daughters and they'll be the first twins on Mars. And, that's what I'm thinking about now, right? I'm not interested in retiring. I'm excited about stuff. I want to, I don't want to sit back in a lounge chair and sun myself. Well, I do sometimes, but you're right. There's going to have to be thinking about that. The one thing I would say is you've got to mix kind of how you put forward the messages and all, because because right now, most people are so far behind on thinking the way we're talking, right? About this being even possible, that, suddenly thinking about the retirement system is a few steps down the way. Again, it's like when I was doing stuff on trade, some of the very specific in the weeds stuff, you had to get them into the concept first before you did that. So I think your point is well taken, and we should think about that, because at some point we are going to be asked about that. And I'm going to have to look into the Space Force opportunities. I have mixed feelings about creating a Space Force, because I don't want to have Star Wars. I would like to have like to have Star Commerce and Star Peace and Star Science and all sorts of cool stuff like that. But there might be some opportunities there too.
Yes, thank you, Edward. And it's an interesting point that Art Ramon has made with regard to some of the obstacles among the wealthier, more prosperous individuals, that they seem to think in this dynastic manner rather than in an individualistic manner. And of course, you and I are individualists. I don't know if in my future I will have children, but if I do, I would actually set up a kind of reverse inheritance for them, in the sense that I would commit to paying them certain fixed sums of money while I'm still alive. However, if I happen to die, at that point, they get absolutely nothing. The remainder of my money would go to some causes that I believe in. But that would set up the incentives correctly. That would give my children an incentive to keep me alive for as long as possible, and spare no expense if it were necessary to give me advanced medical care of some sort, because they would know that as long as I remained alive, they would receive something from me. If I died, they would get nothing. Perhaps this kind of individualistic thinking, if more wealthy people adopted it, would be better for the pursuit of radical life extension. And it would probably be better for their children as well, because then their children wouldn't rely on the inheritance. They would have to make something of themselves as well, and continue this pattern of virtues that lead people to rise financially and economically. So that's a possible way of overcoming that hopefully more people will start thinking the way I do. Now let's go to Pavel Ilin for his concluding remarks.
Hi, Pavel.
Yeah, sorry, I have to press 5 buttons. I'm really glad that there was lots of talking about culture today, and I would agree with Edward and others that we live in this mindset of expectation of dystopia and negativity, because postmodernism deconstructs big narratives, and it not leaves us anything in return. It just leaves us alone in meaningless universe. And I can see escape of this state of mind of endless irony and lack of meaning in forming a new big narrative, which would be based on transhumanism. And what, Edward, what is your thought? How can we? What is your thought in general on big narratives, and how can we form this big narrative, especially while we such a small party and small group? And another question I have is, I haven't heard anyone talked about UBI today, and can you tell us what your stance for on that and why? Yeah, and,
On AI?
UBI.
UBI.
Universal Basic Income.
Oh, right, right. Okay, yeah, sorry. Okay.
Yes, thank you for thanks for coming.
Right. Yeah, on the first one, the narrative thing, I mean, that's a tough one. I mean, my background is sort of political theory, philosophy. I can, if you want me to do a seminar on Aristotle's ethics and posterior analytics, I'd be happy to do that. Who cares about that anymore than me, but there it is. So, kind of that's my my strength. But also, I do have a strength in communicating, because that's what you have to do when you're promoting a public policy. I can't just go into gory details. I have to be able to say, here's a story, here's how this works, and so that's kind of what I do with public policy or as media. I used to do a lot. I still do some media, but when you do media, you've got to go on there and you've got to have your pitch like that. You got to be able to go bang, bang, bang and get people's attention and keep it so. So it's kind of hard to say, how do you change the narrative? Partly it is because, just like in a sense in the 60s, Apollo changed the narrative, I would say. It opened up a vision of what can be done, of space stations, of going to the moon, of doing all these kind of things, as engineering as a really exciting area. And so it did change the narrative, but it was the action and the events that changed the narrative. We have changed the narrative on technology in this country to a certain extent because of the information and communications revolution. A geek like Steve Jobs is considered a cultural hero. People line up to get the newest iPhone or whatever it happens to be. I've got an Oculus out here that my kids absolutely love, with virtual reality. That's pretty darn exciting. So I think we can build on these kinds of breakthroughs and human achievements to start forming, building on them to form a narrative of, look, can you imagine this thing, these things didn't exist, 12 years ago? Can you imagine if the same creativity and entrepreneurship that's allowing us to have this discussion right now went into education, went into healthcare and longevity? Can you imagine that? And so I think that's kind of the way to frame the narrative, is we know that it worked for these things. Why not, do it for all of these other things? Universal basic income, I don't think is a good idea, by the way. As first of all, in a sense, we have a lot of that right now in the current welfare system. and it's spread out. I mean, it's supposed to be targeted at the groups that need it. You know, if you're, I don't need, I wouldn't mind having some extra money, but you know, giving me an extra whatever it is a month, yeah, fine. I could, you know, I could certainly use it, but it's the woman living in inner city Baltimore who really needs it. And so we have a system right now, at least in theory, even though it's very, very clunky, that that basically does does that, but it's a focused system. And we also have all sorts of programs for like food assistance for children, the WIC program, and so forth. And I have criticisms of these systems, but at least it's a focused system on who actually needs it. The other thing is, in a sense, I think of the universal basic income as having the same flaw as government loan guarantees for college has. What happens is, if a college administrator knows that everybody who walks in the door, almost everybody, has a, let's say, $5,000 loan voucher in their back pockets, guess where the bidding is going to start, right? So what happens is you say, well, everyone has that amount of money, so we're going to just start the bidding. The tuition is going to start at that level, and then we're going to build on it and so forth. And so what I worry about is it wouldn't make a whole lot of difference overall, because prices would simply go up accordingly, and it would kind of be a wash. And so I think there are just better ways of doing things. And by the way, what I think, and this is where I think the motivation, I see where the motivation is coming from for universal basic income, is that as we become more technologically advanced, prices do go down so much that it just, for so many things, it just doesn't become an issue anymore. And so I'd rather see it that way and keep the entrepreneurship aspect there. So anyway, I understand the reason why a lot of people, and as Zoltan, I think Zoltan has debated in favor of it. I know a lot of other folks who did, and honest folks, even libertarians, say it would be a better approach than the current system. And that's the other thing, by the way, I might add, is that are you talking about adding it to the current system, or are you talking about replacing the current system with it? And that's where, if you replace the current system with it, you would get a lot of protests about, well, yeah, but Ed Hudgins doesn't need it, but the poor lady in Baltimore who has 6 kids does need it. So can't we index the thing, and then you kind of get back to the system? Okay.
Yes, and thank you for those answers. And Pavel posed some excellent questions on the question of the narrative. This has been an area of emphasis of ours for a long time, how to get past the crisis of meaning in postmodernism and give people a new source of inspiration, a new source of hope. And scientific and technological progress, I would say, offer the best opportunities for that. Now, on the subject of universal basic income, this is interesting because we had a previous virtual Enlightenment Salon with Spike Cohen, the Libertarian Party vice presidential candidate, and he articulated a similar critique to yours in that he said, well, he would consider UBI to be inflationary because if everyone got the same amount of money, they would have more purchasing power, but chasing the same number of goods. And the counter that I provided to this was specifically in the method by which the U.S. Transhumanist Party proposes to fund the UBI, and that is through a federal land dividend. Now, the federal land dividend approach is actually agnostic with regard to whether or not the UBI would be in addition to or a replacement of existing social welfare systems, but it could work with either one, in the sense that it's a new source of funding, but it's a source of funding that is derived from new productive activity, because currently that federal land is completely unused. And we're not talking about national parks or national forests, right, or any place that people would consider scenic or want to visit. So those can still be protected, and there would still be the vast majority of federal land that currently has no use whatsoever. And those companies could use it for any activity, ranching, mining, additional tourism. Maybe some of them would build theme parks on that land and people would come visit. And whatever revenue they generate, that revenue gets distributed as a UBI, well, after the private companies have taken their share, realized what they would consider to be a reasonable profit. And that would not lead to inflation because there are new goods, new services in the economy that are proposed and made available by these private companies. So what do you think about that? Do you think that would alleviate the kind of cost inflation problem that you referenced?
It provides an interesting approach, and I know that Zoltan has talked about this as well. But and by the way, I think in and of itself, it's a good idea to open up federal lands for for commercial and productive uses. But I would point out a couple of things there. One of the problems right now is and you'd have to deal with this, and I'm happy to deal with this, by the way, is the regulatory regime. For example, I remember, gosh, it might have been as long as a couple of decades ago, the early 2000s, looking at mining, for example, in Arizona, and the fact that mining operations were being driven out of Arizona on land that, it was legal to mine, just because of all the stupid regulations. And so these mining interests ended up going overseas, even though the stuff is there, and even though our safety standards are far better than in most less developed countries, and yet they were being driven out. And so the first thing you'd have to do is just overcome the regulations that basically have driven out mining and a lot of these commercial activities, even on land that's not federal land. And then the other thing is, I would say, you've got to look at the actual commercial value of these lands. Zoltan, I know, talked about, well, what if you sold all of this stuff off? Well, there's a reason why it's deserted land, because there's not a lot, even if it weren't government land, right now there's not a lot of commercial value to it, because it's in the middle of a desert or something. But to the extent that people could find commercial value, I think that's a very good idea in and of itself. Then we can go on and talk about whether this would be a good way to fund the universal basic income. I still think there'd be other problems with it, but the discussion is a good discussion about what to do with those lands and how to bring it into some sort of productive use.
Mm-hmm. Yes, and these are very good questions to pose. I will say that the U.S. Transhumanist Party currently has a working group on universal basic income in its incipient stages, where we will explore these ideas in greater detail. So some of the questions, like what value can be realized from the unused federal land, how much revenue could that generate, what level of UBI feasibly would that generate? I know some people have thrown out figures as high as $52,000 a year for every American, but that would, of course, require full-fledged utilization of that land, and that's not going to happen right away. So I am interested in a realistic, pragmatic assessment of what that approach could bring. But I would say to everyone, stay tuned on that, because the working group will hopefully produce an analysis that will be of interest to people, no matter where they stand on the fundamental question of UBI. Now let's go to David Shoemaker for his concluding comments.
Yeah, thank you, Edward. This has been a great session today. And
David, it seems that you are on mute.
Oh, got to click it twice to get it off the mute today. Okay, thanks. Edward, thanks for coming. That's what I was saying. I appreciated hearing you today, and I've been following you for a while, but it's great to actually hear you like this. And I love your ideas on human achievement. I've been reading some of your articles about that, and I think you make some persuasive arguments as far as why human achievement needs to lead. I like the idea that it's a positive, motivating force. As I talk to different people, though, about human achievement, it's interesting some of the things that come back to me. When I ask people about human achievement, they usually answer me talking about their careers, or how much money they made, or something along those lines. I remember Mitt Romney, when he was asked about his fortunes when he was running for president, talked about, and he was posed a similar question, And it came back to, once again, talking about money. Money, his comment was, money was the scorekeeping system for how effective he had been in his adult life. I'm thinking that as we move forward, somehow emphasizing betterment for all of humanity is a much better standard. And I wrestle with the idea of how to convert people away from this idea of career and money to some type of status, maybe based on the type of betterment that you do, that I do, that everyone else does. And I come back to, reputation. Maybe reputation is a good way to do it. But I'm interested if you have some thoughts in that area. I'm struggling with it.
That is an incredible question. On my website, you've probably seen I have a quote: "We are all achievers, whether we're nurturing a child to maturity or a business to profitability, whether we're writing a song or a poem or a business plan or a dissertation, whether we're designing a building or laying its bricks or arranging for its finances." So I'm obviously thinking of achievement in the broadest sense. Raising my 2 9-year-old girlies is, I hope I do a good job of it. It's tough, especially because they love their tablets and YouTube better than they love me trying to lecture them about science. We'll work on that one. But to me, achievement is not just how much money. Otherwise, I'm a complete failure, I'm sorry to say. We'll see if I can get some fundraising to reverse that situation. But I consider myself a human. I know Gennady, we've talked about this. I consider myself a humanist, also a transhumanist. But I could quote Horace, the Roman thinker, who said, "Quisicitur liber est, sapiens qui sibi imperat." Who therefore is free? It's the wise man who's in control of himself. I'm very influenced by my hero. My Bible is Aristotle, the Nicomachean Ethics, or if you want to read Cicero and the Stoics about virtue. And to me, and maybe I should emphasize this on my website, and thank you for the insight, that the most important achievement is the creation of your own moral character, of your own soul, psyche, in the or anima in the Latin, psyche in the Greek. It's because all of the achievements we're talking about that we're also excited about comes from something in here. It comes from our rational capacity. It comes from our emotional capacity. Aristotle in Nicomachean Ethics talks about the integration of the mind and the soul and the emotions. The virtues for him is to not become a complete ascetic and not enjoy the great things in life, but to enjoy them in moderation. What is courage? It's somewhere between cowardice and foolhardiness, right? What is temperance? It's not rejecting, it's not being an ascetic, it's enjoying it to not overindulging, it's right in the middle there. And it's putting all of those together and then doing it at the right time in the right manner and everyone reads Nicomachean Ethics. So that's my thinking about achievement, that it really does involve moral character in the sense, this kind of classic sense. And you find this, by the way, in Confucius. So for those who say, well, is this just a Western idea? Well, no, you find it in other wise cultures as well. I do like the term betterment. I sort of picked achievement because I thought it was something that would be more accessible, but I do mean it in the terms of human betterment. So I'm not saying everyone should go out and become rich, because once you've got the fourth mansion, maybe it's cool for you, but I'm satisfied with the one. I don't have the one yet, so I got to work on that. But I think this is really important in terms of the questions we had earlier about a narrative. Pavel, you asked about a narrative earlier, and one of the things I think we can do with human achievement is to talk about it in this wider sense, in this sense of personal fulfillment that you might get from raising a child, from doing these things that don't necessarily involve money, though you're happy to have the money. So I think that this is really a key point, and really, and again, just as you were talking about, why would people want to go into engineering and so forth with Apollo? Well, it was because they were just inspired by what they can do. It was Steve Jobs talking about making a dent in the universe, right? And that's why I'd like to see more young people, instead of virtue signaling by going out in the streets and wrecking buildings, go into a laboratory and do what Aubrey de Grey is doing. Or, it doesn't have to just be in that area, so many other areas. But your point is just, you're right on the mark about this.
Yes, indeed. And I think for many people, money is essentially a means to an end. It's not the accumulation of money in itself that is valuable, but what that money enables people to do and to achieve. And yet, also, there are certain activities that don't directly bring a monetary income, but could be worthwhile to pursue in and of themselves. And one of the questions for good policy is, how do we enable more of these kinds of activities and less of the destructive kinds of activities, the people going out and wrecking things, because clearly that's a detriment to future prosperity. A lot of these areas, for instance, are not going to come back from billions of dollars of destruction, unfortunately. And that is the outcome we should all seek to avoid, no matter what our political persuasions might be. So thank you for those responses, Edward, and thank you for your question, David. Now we go to Dan Elton for his concluding statements.
Okay. I don't have a lot to say right now, but I really, I really support what you're doing. I'm very excited about the Human Achievement Alliance. I think maybe we should try to get a group together to, support you in this effort. I know a lot of transhumanists in the area, and such that would be interested. And I think we should look at this burgeoning field of progress studies that has been proposed by Tyler Cohen and Patrick Collison. Next Sunday, we're going to have Jason Crawford to talk about that. And I think what they're finding in progress studies is that the culture is extremely important for seeding planting the seeds of progress. So that'll be really interesting. But I'll leave it there, and I'd love to follow up with that some later time.
And by the way, Dan is a local like me, so I spoke at the Futurist group summer or two ago, and so it's easy for us to get together. By the way, you're right about the studies. This is another thing. If you're looking for some optimism, not only can I wave around Pinker's book here, and Peter Diamandis's book. Like, here's Matt Ridley's book, How Innovation Works. Ron Bailey and Marian Tupy at Cato just published a book on human progress. They have a very good program over there. Competitive Enterprise Institute, by the way, one of the think tanks in the DC area, is really promoting this kind of thing. And they're very big on this.
This is something I'm really interested in. I'm actually looking for books to read on this subject. So thank you.
Yeah. And we can talk offline, or you can email me or text offline. But there's a lot of really good stuff. I've got a lot of books on my shelf in case. There's another one.
There was one on Bell Labs that I listened to an audiobook of a few years ago, which is called The Idea Factory, and that's about how the amazing culture at Bell Labs allow them to invent all this stuff, satellite communication, Linux, the transistor.
There's another one here that came out recently by someone I know. I just don't see it on my shelf right now. So I can give you a list. And in fact, one of the things I'm going to do on my website, and I encourage everyone to go to www.humanhumanrights.org. I have a resource section that I haven't built out yet. But what that section is going to be is it's going to be, just here's a whole list of stuff. Here's this book. Here's what it says. Here's why you might be interested in it. Here's, Matt Ridley's new book. Here's Ron Bailey's new book. There's just there is a ton of stuff. And again, you mentioned Tyler Cowen out at Mercatus, and so there is a very good academic interest. And in terms of, wouldn't it be great if instead of people reading postmodernist garbage in universities, they start reading stuff like this? And they're now producing this intellectual work that hopefully will be the stuff that someone says, well, what do you have? And I'll say, well,
yeah. I actually have Steven Pinker's book here too, because I was when you brought up inequality, I when I grabbed this book to look to remind myself what he said in here, because he has a great chapter in here on inequality.
I know,
where he really lays a lot of the doom and gloom to rest.
Yes.
I don't want to go into all that right now because it's a whole nother tangent, but he kind of, he lays to rest the idea that inequality is going to cause huge upheaval and social unrest. And
and by the way, if everybody, I mean, the one sentence argument is that everybody is richer. The fact that Steve Jobs is dead, unfortunately, but the fact that Jeff Bezos is richer than everybody, who cares? I'm enjoying myself right now.
Right. There's empirical what he references in.
Thank you. We should build
empirical research.
Yeah, and he does very good empirical research on that, and it also points out about how everyone read the book. Okay, I can't do any better than Steven Pinker. So read Steven Pinker.
Yeah.
Yes, and I would add to this, of course, the argument that I've often made that being alive is the greatest wealth. So we are all wealthier than Steve Jobs. We may not be wealthier than Bill Gates or Elon Musk, but we're wealthier than John D. Rockefeller or Andrew Carnegie or King Louis XIV, even though they were fabulously wealthy for their day, but they can no longer enjoy their wealth at all. Whereas we can enjoy what we have. And I would say the greatest inequality is between the living and the dead. And we should try to keep as many people on the side of the living as possible. So thank you for that discussion. And thank you, Dan, for bringing up the Virtual Enlightenment Salon next week on progress. So Jason Crawford is one of the purveyors of the emerging discipline of progress studies. And this conversation that just transpired is a great lead-in to our discussion with him, which will be focused on what can be done in this society to catalyze progress in ways that are effective. And he may have some different ideas from those that the US Transhumanist Party has pursued, but I think it is important to consider various perspectives on this question and really figure out which approaches are the most effective. In some ways, the conversation today showed us that our contemporary society is in a conundrum, and that's illustrated by a lot of the crises that are ongoing right now, where on the one hand, we have marvelous possibilities made available by science and technology. On the other hand, the pessimism, the rancor, the despair, the toxicity of contemporary culture is preventing us from fully utilizing those possibilities. And hopefully with insights like the ones we gained from Edward and like the ones we hope to gain from Jason Crawford, we'll figure out a constructive way forward to resolve these conundrums. And now we have come to the point in the salon where our guest will offer us his concluding thoughts on anything that has been discussed or anything else that you would like to elaborate upon, Edward.
Okay.
Please go ahead.
Okay, yeah. Just first of all, thanks for a great discussion. I mean, for people who say, how can you overcome the pessimism and this and that and the other? being energized by a discussion like this, there's one of your answers right now. So that, and I always am, certainly, and I hope everybody else is. I would say, by the way, one of the things to just inject in this discussion about human achievement and what I'm trying to do is, and Janati, you alluded to this. I'm an individualist, and that doesn't mean I exclude other people. In fact, I want to work with other people and love other people and so forth. But it means that I understand that it's the individual who comes up with a brilliant idea and they try it out. Maybe it doesn't work. Maybe it does work. They pursue it. And all of the achievers who I have on my little banner here, are people who kind of thought outside the box and who were innovators in some way, shape, or form. Many of them were denounced or looked at as nuts and so forth and so forth. So when we talk about, especially as we get into some of the more economic stuff and so forth, I recognize that it was the innovators who were free, who had the liberty and the freedom to try something different, that were able to, bring about the progress we've seen certainly in the last 200, 300 years. Since David, you were talking about space policy, when in 1920s, the New York Times had scathing pieces of this nut called Robert Goddard, who actually thought that rockets could fly in space. And his first rocket only went up like 41 feet or 44 feet. Ha ha ha! Look at this idiot! Look at this kook! And during Apollo 11 mission, 1969, at NASA Goddard over here, where I was a high school intern, the New York Times actually posted a retraction saying we were wrong. And when you went into the buildings over there at NASA Goddard, they always had this display of sort of what the big things were for the day. And that particular day, they posted the New York Times saying, "Yep, we blew it." And so anyway, so I just want to emphasize the importance of the individual, the dignity of the individual, the innovation of the individual, and how part of what I want to do is empower all individuals. And again, I hope everyone will take a look at the website, humanachievementalliance.org. I'm interested in continuing to work with people. I know I'm going to be doing that. Recommendations are always suggested. I'm going to be hopefully getting my C3 status and doing fundraising coming up soon. And so, this is my mission. And I want to be around in the next century or two with my little girls, who will be big girls by that time, and my wonderful wife. So I'm just excited, and thank you for a wonderful session, guys.
Yes, thank you so much, Edward, for joining us today. And indeed, we are completely with you when it comes to the support of innovators and achievers. I would say there's no better home for innovators than the U.S. Transhumanist Party, because we are always going to be on their side. So thank you for your work in this area. We wish you all the best with the Human Achievement Alliance. We look forward to our future collaborations, and I hope that everyone in the audience enjoyed this conversation, found something worthwhile to take away from it and ponder on whatever your political leanings. I think it's important to explore constructive possibilities for solving the problems of our time. And until next week's Virtual Enlightenment Salon, live long and prosper.
Okay,